Hello, good morning. Hi, good afternoon na pala, past 12 na, sorry. Good afternoon. Our topic for today, we are on the PEEP week of the calendar. A PEEP week is about hematologic disorders or disorders of the blood and blood vessels. Our learning objectives for today are to review the process of, blood formation, to discuss the hematologic disorders, the different types of anemia, the bleeding disorders, as well as disorders of the blood vessels like hypertension, aneurysm, peripheral vascular disease. As to etiology, what are the signs and symptoms, management, and utilize the nursing process in the care of clients with these hematologic disorders. First, this is our blood. When blood is placed in a test tube, the cellular elements will settle down at the bottom of the test tube. So what are these cellular elements? So that of the RBC, WBC, and platelets. While nasa ibabaw is the liquid portion of the blood, which is the plasma, which contain water, electrolytes, as well as the clotting factors. Okay. And what are these cellular elements? Excuse me. The cellular elements. We have the RBC, which are millones in number. We have the platelets, no? The platelets, ito yung maliliit na platelets, yan. So ito, these are our WBC. Okay. Blood formation or the process of hemopoiesis or hematopoiesis occurs in the bone marrow. In the bone marrow of the flat bones, okay? In the bone marrow of the flat bones, the pelvis, the ribs, the sternum, and end of the femur, and humerus in adult. Okay, so the bone marrow produces white blood cells, which are responsible to fight infection, our body soldiers, while the red blood cells are the one which carry oxygen. So ito mismo responsible for transportation of oxygen to the different body cells, while the platelets are responsible for blood clotting. You would see in here that blood formation occurs in the bone marrow. It originates in the pluripotent stem cell of the bone marrow, wherein this pluripotent stem cell is committed to proliferate and divide into myeloid stem cell and lymphoid stem cell. Okay, so the myeloid stem cell will proliferate, will differentiate, and grow into pro-erythroblast, reticulocyte, at siya yung magiging erythrocyte or RBC. The myeloid stem cell will also proliferate and differentiate into megakaryoblast, megakaryocytes, and platelets or thrombocytes. Also, myeloid stem cell will give rise to eosinophilic myeloblast na magiging eosinophils. Basophilic myeloblast na magiging basophils. And that of myeloblasts will become neutrophils and monocytes. While the lymphoid stem cell, okay, while the lymphoid stem cell will give rise to T and B lymphoblasts na magiging T cell or T lymphocyte and B lymphocytes, which are responsible also for autoimmune reaction. Okay, so meaning all the blood cells originate in the pluripotent stem cell. So ito yung mga mature cells na if the patient had CBC, complete blood count, ito yung lalabas na mga cell count. Okay? And if the client has bone marrow injury, then you would see what are the cells which are decreased in number. So we have the RBC, WBC, platelets will be decreased in number. There will be pancytopenia. Okay? So the red blood cells, the WBC, the platelets, and differential count, the different WBC originate in the pluripotent stem cell. Okay. So what are the normal values? So the source is the Ignatovicius. So we have also each book, each laboratory release the different normal values, may counting variation, but it is negligible. Okay, still very much acceptable. Like the RBC, red blood cell count, that's about 4.2 to 5.4 millions. No? And then the male is higher, 4.7 to 6.1. While hemoglobin, female is about 12 to 16 grams per DL, while male, about 14 to 18 grams per DL. Hematocrit, ano yung tinatawag natin hematocrit? Hematocrit is the ratio between the blood cells and the plasma. Na the female is about 37 to 47%, while the male 42 to 52%. If you will take a look at the numbers, mababa ang RBC count, hemoglobin, at hematocrit ni female compared with the male because of regular blood losses during menstruation. Pero pareho lang sila ng WBC, both sexes, 5,000 to 10,000, and platelets being 150 to 400,000. So which is the one responsible for blood clotting. So we have here a sample as hematology report about the CBC from Fatima University Medical Center. Okay, so if you will take a look, WBC 5.2 normal. Okay, hemoglobin 166 normal. Okay, so this is a male client, no? Tapos ang RBC niya, normal. Platelets, normal. So you will see this reveal normal complete blood count. In other countries like British, they call that FBC, full blood count, wherein the blood sample can be taken either by venesection, by the use of syringe and needle, or by finger stick. So tutusok and then get sample. Okay, blood can be taken anytime, no special preparation. In this slide is the process of RBC destruction, wherein the lifespan of RBC is 120 days. Okay, the lifespan. And the RBC is ruptured by the spleen. Kumbaga, si spleen ang nagtatanggal ng balat ng RBC. Okay? So after 120 days, the RBC is ruptured by the spleen. As a result, hemoglobin is set free. Hemoglobin is set free. Hemoglobin, okay, will dissociate. Okay? The RBC is ruptured by the spleen. Hemoglobin is set free. Hemoglobin will dissociate into heme portion and globin molecule. So globin molecule is recycled, reused for future protein synthesis. While the heme portion divides, no, or it frees the iron and porphyrin molecule, which will become biliverdin. Okay, the heme portion releases the iron and it is being stored in the liver in the form of ferritin. And from the liver, it is transported or it passes through the blood and used for future blood formation, which occurs in the bone marrow. Okay. While the porphyrin molecule becomes biliverdin, converted to indirect bilirubin. It goes to the liver, and the liver conjugate it to direct bilirubin. So indirect is converted to direct bilirubin. And this bilirubin is now part of the bile. So what is the function of the liver is to produce bile, which is the end product of RBC destruction. So that bile contains the yellow portion, bilirubin, calcium salts, bile salts, water, and it leaves the liver through the hepatic duct. So we have the right and left hepatic duct, common hepatic duct, cystic duct, and to the gallbladder. Bile is stored and concentrated by the gallbladder. When food is present in the small intestine, especially fat, then there will be release of CCK pancreocymin. Cholecystokinin will cause the gallbladder to contract, while pancreocymin will cause the pancreas to release pancreatic juice for digestion. Now, gallbladder contracts and release the bile. It passes through the cystic duct, common bile duct, and into the small intestine. Bile is needed for emulsification of fats. Okay, and then it goes to the bilirubin goes to the small intestine and being absorbed and absorbed in the bloodstream and being excreted in the urine by the kidney in the form of urobilin to give color to the urine. That's why what is the normal color of the urine? It's yellow, amber in color. While bilirubin continue in the large intestine to give color to the stool or to the feces. The yellow pigment in the feces is stercobilin. That's why, anong kulay ng pupo natin? Brown in color. Okay? So what is the end product of RBC destruction? Bilirubin. Okay. Blood formation occurs in the bone marrow, okay, of the flat bones, especially the pelvis, the ribs, the sternum, and in the end of the uterus and that of humerus in adult. So the process of blood formation is called hematopoiesis or hemopoiesis. RBC production is erythropoiesis. Platelets, thrombopoiesis. WBC, leukopoiesis, or in general, hematopoiesis. What are the ingredients needed for blood formation? Of course, we need the iron to give color to the blood. We need the vitamin B12 and folic acid for maturation of RBC. And for absorption of vitamin B12, kailangan natin ang intrinsic factor. We need a hormone, erythropoietin, which is produced by the kidney. Okay? When there's renal hypoxia, erythropoietin is released by the kidney, and this will stimulate the bone marrow to produce RBC. Okay. When there is missing ingredients na gamit natin for blood production, then magkakaroon tayo ng anemia. And that anemia is called hypoproliferative anemia. Okay? So, the end product of RBC destruction is bilirubin. If there's premature destruction of RBC or excessive destruction of RBC, then ang tawag natin doon ay hemolytic anemia na si patient magkakaroon ng jaundice. Ano ebidensya? Mata, yellow, okay, or icterus. Then the skin is yellowish. At pagka may jaundice, it is accompanied by bile salts in the skin, kaya may pruritus. Tapos anong effect on the urine? The urine is tea-colored, parang tsaa. Okay? Now, that is hemolytic anemia. What type of jaundice? Hemolytic jaundice. Okay. Now, if there's problem with the liver, so the liver is unable to convert indirect to direct bilirubin, yun ang tatawag natin hepatocellular jaundice. Nang mismo may problema si liver. Kaya it happened when there's liver cirrhosis, when there's liver cancer. There's obstruction with a common bile duct. Ano ebidensya? Anong cause? May gallstone. May gallstone, the common bile duct. So therefore, bile does not normally reach the small intestine. Kaya, ano ang kulay ng pupo? It lacks stercobilin. Kaya the color of the stool is gray colored, a colic stool. Okay, so that's very important now to understand the RBC destruction. The end product, bilirubin. Okay, so therefore, let's move on with anemia. So ano yung tinatawag nating anemia? Anemia is a condition wherein there is decrease in RBC, decrease in hemoglobin and hematocrit. So kung ito yung normal amount of red blood cells compared with the liquid portion, the water, the hematocrit is normal, 37 to 47 para sa mga babae. Pero take a look, dahil less ang RBC, anong dugo? Malabnaw, malapot? Siyempre, ang dugo natin, malabnaw. Okay, malabnaw. Kaya, mababa ang hematocrit. Okay, mababa ang hematocrit. There's hemodilution. Okay, now, what are the causes? What are the causes of anemia? 1. Lagyan natin ang adjective, severe blood loss, which could be acute or chronic. Severe blood loss. Marami. Halimbawa, nanganak, normal spontaneous delivery, had massive postpartum bleeding. Normally, ang blood loss is only about 500. Pero nagkaroon siya ng severe bleeding, most probably secondary to uterine atony, o kaya may may retained placental fragments, o kaya may lacerations, perineal lacerations. Or dili kaya, because of severe trauma, nasaksak na baril, nagkaroon ng massive bleeding. Okay. Or, si patient po ay may bleeding peptic ulcer. Bleeding peptic ulcer. There's hematemesis, vomiting of blood. Passage of black tarry stool. Or one patient has a severe hematochezia. Lalaki, pero para siya may menstruation. Ayun, that is severe blood loss. It can be acute or chronic blood loss. Ano naman yung chronic blood loss? Ito paunti-unti lang. Pagka siya ay pumupo, pag siya ay constipated, no? Nagbi-bleed siya, hematochezia, pulang-pula yung inodoro. Pero pag wala siyang constipation, okay lang. Pero tumagal, no? ng 1 buwan, 2 buwan, 3 buwan, 1 taon, no? Na nagbi-bleed, yun ang chronic blood loss. Secondary to that of hemorrhoids. It will also lead to anemia. Inadequate or abnormal RBC production. Kailan yun? Pag may kulang tayo ng iron, kulang tayo ng intrinsic factor, kulang ng vitamin B12, okay? O kaya kulang ng erythropoietin on patient with renal failure. So that is anemia, secondary to inadequate or abnormal RBC production. Ang tawagan natin doon, hypoproliferative anemia. While the third is secondary to premature or excessive destruction of RBC. Talaga mo na-destroy siya after 120 days. Kailan nagkaroon ng premature destruction? Halimbawa, yung patient had a congenital problem, there's thalassemia, a G6PD deficiency, so therefore there will be a premature destruction of RBC. Or si patient ay may nag-undergo ng cardiopulmonary bypass. Okay? O nagkaroon ng burn injury. Burn injury. So there's that of full thickness burn. There's damage to the blood vessel and damage to the blood cell. That is hemolytic anemia. Okay? So balikan natin, secondary to acute or severe blood loss. Ito yung hemorrhagic anemia. The patient will present with hypovolemic shock. Babagsak ang blood pressure, there's tachycardia, there's tachypnea. Na kinakailangan bigyan natin siya ng blood transfusion. Okay, so that of fresh whole blood or packed red blood cell transfusion. Okay, yan ang general causes. Now, the disorders we're going to discuss are secondary to decrease or abnormal production of RBC. Iron deficiency, IDA, iron deficiency or IDA. So from the word, anong kulang? Iron. So kailangan natin ng iron for to give color to the blood para tama yung size and color of the blood. And what are the causes? What are the causes of iron deficiency anemia? Pagka-iron deficiency, maliliit ang mga blood cell natin. Microcytic, putla, hypochromic, maliliit na makikita natin doon sa MC volume and MCH hemoglobin na parte ng CBC, complete blood count. So, what are among the causes? Secondary to inadequate intake of iron. So, secondary to malnutrition or decreased absorption of iron in the gastrointestinal tract. Meron pala siyang malabsorption. Or excessive loss of iron. Diba? Nung si patient ay nag-bleed, iron is also lost. Kaya basta nag-bleed, si mother ng anak and postpartum bleeding will have iron deficiency anemia. Kaya parte nga po ng prenatal care. Kasi expected natin na mga anak si mother will have postpartum bleeding. Kaya bibigyan na siya ng prophylactic dose of iron like Feosol tablet. All right. What are the signs and symptoms of anemia? Low hemoglobin, decreased transportation of oxygen to the different body cells. Kaya there will be altered tissue perfusion. Ano ebidensya? There's pallor, weakness, fatigue. Okay. So there's reduced energy, cold sensitivity, fatigue, dyspnea on exertion. Ano nursing diagnosis? Fatigue or activity intolerance. Anong compensation ng puso? The heart will compensate by tachycardia. So there's tachycardia even at rest. So what are the cardinal signs? Pallor, weakness, fatigue. Saan mo makikita ang pallor? Pale palpebral conjunctiva, pale lips and mucous membrane. Tignan nyo ang palad at saka talampakan. May pallor. Okay. Severe type of anemia, severe and chronic type of anemia, there's stomatitis, there's dysphagia. Stomatitis is inflammation of the oral mucosal membrane. Dysphagia, there's difficulty of swallowing because with severe type of IDA, there is web-like growth of membranes in the throat. Kaya mahirapan siyang lumulon. Glossitis is inflammation of the tongue. Koilonychia is spoon-shaped fingernails or concave fingernails. Okay. Yan ang chylosis. Chylosis are lesions at the corners of the mouth. And there is pica or pica. Ano yun? So this is craving for non-edible substances like clay, laundry soap, okay, starch, and uncooked rice. Okay, craving for unedible substances. Actually, kaya siya may pica, siguro may psychological problem siya, psychiatric problem. Kaya yun ang mga kinakain niya. So dahil yun ang kinakain niya, unedible, so therefore there's decreased intake of nutrients. And one of this is evidenced by IDA, iron deficiency anemia. All right. And of course, the CBC will reveal decreased CBC, hemoglobin, hematocrit, and serum iron. All right. And blood smear reveals microcytic hypochromic RBC. Anong normal? Anong adjective? Normocytic, normochromic. Yun ang normal. Ito, maliliit at putla. Okay. na makikita nga natin doon sa mean corpuscle hemoglobin and mean corpuscle volume na parte ng CBC. Okay. Medical management, treat and eliminate the cause. And correction of faulty diet, no? Oral supplement or parenteral administration of iron, treat and eliminate the cause. Kung siya ay postpartum bleeding, secondary to uterine atony pala, o di kailangan niya ng oxytocin. O kaya there's retained placental fragments, di magdi-DNC, no, para tanggalin yung retained placental fragments, address the cause. Kung siya ay GI bleeding, because the client has bleeding peptic ulcer, so kailangan ng lavage, gastric lavage, address the cause. We have a faculty, assigned siya sa Pabella, no? So sa Pabella Memorial and Medical Center, sa DR, delivery room. Alam mo po, itong faculty namin ay napakasipag. Work 2 to 10 shift. At kung walang ka-endorse ng 10 to 6, nagsi-16 hours. Kayang-kaya niyang magpasok, no? Pumasok, at magpaanak, assist our students for 16 hours. Kasi hindi naman ganun kahirap, hindi naman po ganun kahirap yung trabaho, no, na nagpapaanak ka lang, although puyat. Okay? Pero paano nalaman na mayroon siyang IDA? February din is the coronation night for Mr. and Miss Nursing. Doon sa old AMS building. Wala pang elevator noon. Kaya maghahagdan laang. Galing kasi ikaw sa CAS, aakyat ka. Okay? Di ba? From the ground, aakyat ka sa CAS, papunta the second floor. Paglipat mo sa kabilang building, ground floor pa rin yun. Okay? Pagdating niya sa third floor, nag-collapse siya. Nag-collapse. And therefore, brought by students to the FPMC Medical Center sa Fatima. Hemoglobin niya, below 8. May severe anemia pala siya. Kaya, kasi ang hirap umakyat, di ba? Ang hirap umakyat against gravity. So kahit sa sarili niya, hindi din niya na-assess yung sarili niya na may anemia pala siya. Hindi na rin namin siya nakikita kasi nag-work nga siya 16 hours tapos ang sweldo pa through ATM. Okay? Ang nalaman na lang namin, nandito siya sa hospital and asking for help, asking for assistance, no? Kung sinong estudyante ang pwedeng mag-donate ng blood. Kasi nabigyan siya ng about 5 units of blood. May mga nag-respond naman to the call. Okay? At siya yung may bleeding hemorrhoids. Okay? Pero ang tagal na ng hemorrhoids niya. So the surgery for hemorrhoids is elective unless the client is having the bleeding at nag-anemia na nga siya. Okay? So address the cause. And ano ang cause? May hemorrhoids. Kaya nag-hemorrhoidectomy bukod sa blood transfusion. Correction of faulty diet, kung ano man yung cause, oral supplement, or parenteral administration of iron. Okay. Now, ayun, blood transfusion in severe cases. Actually, what are the grading of anemia? Di ba, pag babae, 12 to 14. Ang grade 1, mild, hemoglobin is below 10. Grade 2, moderate, 8 to 10 grams. Grade 3, severe, less than 8. So therefore si ma'am, below 8, severe na yun. Okay? And then, mas mababa pa dito, 7, 6, life-threatening, 5. We had one patient in the hospital na ang hemoglobin niya ay 5. Pero refuse blood transfusion. Ayaw na ayaw talaga niya. Hindi na nakaya ng puso yun. So the patient died of cardiac arrest. Okay? Sino ang bibigyan ng blood transfusion? If the hemoglobin if it is about moderate, 8 to 10. Pero ngayong mild is less than 10. Okay. Then the nursing management, monitor for signs and symptoms of abnormal bleeding, especially from the GIT. Yan, yun nga, nagvomit ba siya, hematemesis, melena, o kaya hematocrysia. And of course, because of decreased oxygen carrying capacity of the blood, there's altered tissue perfusion, we have to provide bed rest. But the patient can have bathroom privileges. Plan activities now so as to not to overtire the patient. And provide a thorough explanation of all diagnostic tests to determine the possible cause of bleeding. We have to allay anxiety and ensure cooperation. If the patient says na siya daw ay sumusuka ng dugo, ito si doctor will plan for upper endoscopy, like EGD, esophago, gastro, duodenoscopy, to prepare patient for that procedure. Like obtaining consent, explain the procedure, remove the dentures, oral hygiene. Pero si ma'am, nakinuwento ko, no need for diagnostic test kasi siya mismo may sabi at nag-report sa doktor, Doc, mayroon akong hemorrhoids. Ayan. Kaya no need for anoscopy. Okay? Kasi confirm na meron siya nito. Alright. Continue the nursing management. Administer iron preparation as ordered. Oral iron supplement for mild iron losses, ferrous sulfate, ferrous gluconate. Prophylactic use, 300 to 325 milligrams. Kaya nga, si patient buntis, part of the prenatal drug niya is iron supplement once a day. Ano yung therapeutic? Yung therapeutic, meron na siyang signs and symptoms sa panemia. Bibigyan siya ng 2, 3 to 4 tablets of iron. Or kadalasan, 3 tablets, 1 tablet 3 times a day. Okay? So, take iron with or immediately after a meal to avoid GI upset. Marami pong questions about IDA kasi this is very common sa Pilipinas, especially during pregnancy. Iron to be absorbed best, kailangan empty stomach and together with vitamin C. So isabay yung orange juice, vitamin C, to increase absorption. But it causes GI upset. And therefore, to prevent GI upset, take iron with meal or immediately after a meal. Okay? Huwag malilito, huwag basta mag-memorize, no? 3 times a day ang iron. So ito yung NCLEX question. So the client, is to receive iron supplement 3 times a day. The nurse should administer before meal, after meal, or in between meal. What's your answer? Please open your microphone or you may chat. For better absorption before meal. But it causes GI upset. So, pwede ibigay after meal, with meal, or immediately after a meal to prevent GI upset para hindi sumakit ang tiyan. Pero kung may choice, in between meal, that's the best answer. May specific time pa nga 10 a.m., 3 p.m., and at bedtime. Bakit yun ang best answer? Pag in between meal, hindi totally empty si stomach. Therefore, ma-absorb. Hindi mag-GI upset. So that's the best answer. Pero kung simple ang tanong lang, iron is best absorbed before meal or after meal? Sagot, before meal. Another question, to prevent GI upset, kailan ibibigay? After meal. Kung may choices, in between meal, that's the answer. Okay? Sabi ko, huwag lang basta kabisote ha, alamin ano ba yung tinatanong. Alright. Children, liquid, hemorrhage stains the teeth. So another question, serve with a straw to prevent staining the teeth. All right. Iron, dark, it darken the soul. Kaya the soul will be dark, green, or black, harmless side effect, nothing to worry about. It causes constipation. So therefore, nurse, since it causes constipation, encourage fluid intake and encourage high fiber diet. Ayan ang mga tatandaan about administration of iron. Parenteral. Sino bibigyan natin ng parenteral iron? Parenteral iron if there's severe anemia or dili kaya the client is intolerant to oral preparation. Nung kami estudyante, nakabigay ako ng Jectofor sa San Lazaro. Okay? Severe type Jectofor to be given deep IM. Jectofor is available in an ampule. You learn in your fundamentals of nursing. If you aspirate through an ampule, hindi naman pumurol yung needle. No need to change the aspirating needle. Magpapalit ka lang pagka you aspirate through a vial. Pero ito ay Jectofor iron. Pag nilubog mo yung needle sa ampule, na dark yung iron, it will stain the needle. Eh pag itutusok mo, may stain mo ang tissue and there'll be irritation. That's why you have to change the aspirating needle. Pagka ang inaspirate mo ay iron. Ayun. Use one needle to withdraw and another to administer the drug, no, in order to prevent tissue staining and irritation. Use Z-Track technique to prevent leakage into the tissues. Ayan. Ito ang Z-Track technique. Deep IM. Lahat ng Jectofor, lahat ng iron preparation sa buttocks, deep IM. Gagawa ka ng cording Z. Okay, detusok mo. Okay, pinalitan mo na yung needle, hindi na yung aspirating needle. And then when you release, ayan ang muscle, ayan ang tinaanan niya, skin, sub-Q. And then when you release, ayan. So it will prevent staining the tissue. Okay? Z-Track technique. Ano pa? Don't massage. Do not massage the injection site because you will also stain the tissue. But encourage ambulation to enhance absorption. Advice against vigorous exercise and constrictive garments. Okay. So, provide dietary teaching about the foods high in iron. Ayan. So, kumakain naman kayo yan. Liver, especially pork and lamb. Medyo mahal yan. Red meat, organ meats, kidney beans, whole wheat breads and cereals, green leafy vegetables, carrots, egg yolk, raisins. Okay. Balik kayo yung liver. Ang sarap ng lutuin ang atay, organ meats, yung inihaw. Alam mo po, ako first time nakakain ng liver na inihaw, may edad na. Ang sarap pala ng liver na inihaw, malinamnam. Pero among these, the best source is egg. Best source of iron. Okay. Now to prevent constipation, encourage high roughage diet, high fiber, and increase fluid intake. All right? So, yan ang mga tatandaan about iron. Ayan, best sources of iron, red meat, chicken, turkey, eggs. Okay? Kasi eggs is highly affordable. All right. Pernicious anemia. When we say pernicious anemia, ang kulang naman dito ay kulang ng vitamin B12. Hindi na-absorb because of deficiency of intrinsic factor. Intrinsic factor is normally produced by the gastric mucosa. Pagka walang intrinsic factor, vitamin B12 cannot be absorbed. Kailangan natin ng vitamin B12 for maturation of RBC. Kaya pagka walang vitamin B12, ano ang mangyayari? There will be improper DNA synthesis. Kaya ang cells natin, megaloblast, may L, megaloblast or macrocytic cells, malalaki, primitive, premature. And therefore, pagka primitive, premature, ating RBC, short lifespan. Kaya in severe cases, mag-jaundice din ang pasyente. Okay. So, bakit may paresthesia? May paresthesia, may numbness, there could be paralysis, there could be ataxia, because the vitamin B12 also play a role in normal nerve cell function. Kaya, dagdag ko lang, if the patient has cerebrovascular accident, diba, there's damage to the neurons. Part of the therapy is vitamin B12 in the form of neurobion. Okay? So, ayan yung ating WBC. No? So, malalaki, megaloblast, tapos hindi buo, premature, and short lifespan. Okay. Anong assessment findings? We have three sets. We have three sets of manifestations. One set is secondary to anemia. Okay? One set is secondary to anemia, wherein there will be pallor, weakness, fatigue. And take note, it is usually seen in elderly. So therefore, naaral nyo doon sa GERIA na pagka may edad ng pasyente, there's atrophy of the gastric mucosa. Atrophy, lumiliit, and therefore decreased production of intrinsic factor. Pwede rin sa pasyente na with removal of the stomach. Bakit naman tinanggal ang stomach? Probably there's gastric cancer. Also, cancer of the small intestine. Kaya nagkaroon ng bowel resection like removal of the ileum. The vitamin B12 is the extrinsic factor. The intrinsic factor is one which is produced inside by the stomach. The two intrinsic factor, extrinsic factor is called hematopoietic factor, which is absorbed in the small intestine. Kaya pag nag-procedure, nag-operasyon sa stomach, sa ileum, pagkakaroon din siya ng pernicious anemia. Okay. So what are the triads of symptoms? We have GI symptoms. We have stomatitis, glossitis, or a smooth beefy red tongue. GI symptoms. Pangalawa are symptoms related to anemia, pallor, weakness, fatigue. Pangatlo, okay? So, severe cases, there is jaundice, na? Kasi short lang, I'm lifespan ng RBC. And there's numbness, tingling in the arms, legs, gait problem, ataxia, neurologic involvement. Okay, what are the triads? One, secondary to anemia, pallor, weakness, fatigue. Anong nursing diagnosis? Nursing diagnosis, activity intolerance, altered tissue perfusion, or simply fatigue. Natatamad ako haba, activity intolerance, fatigue, madaling mapagod. Okay. Pangalawa, ito, stomatitis, glossitis. So there's alteration in oral mucous membrane. At dahil dito, dahil may mga singaw siya dyan, there are cracks no, in the corners of the mouth. So therefore, patient can have alteration in oral mucous membrane or hindi siya makakakain. Imbalance nutrition, less than body requirements. Ito, numbness, tingling sensation. There's ataxia, fall, risk for fall injury, o kaya risk for burn injury. Ayan ang mga pertinent nursing diagnosis. All right. Okay. So, on your left or on your right, nasa ng glossitis, beefy red tongue, pulang-pula ang dila. On your left or on your right? Okay, so tingnan natin kung may sagot dito. On the left, thank you. Okay, thank you, Marika. Thank you, Maria, from Section 8. Okay. Ayan. Alam mo po, sa edad ko na to, sa tagal namin sa clinical area, first time ako nakakita ng ganyan, talagang pulang-pula ang dila. No? So, beefy red tongue, glossitis. Kaya ano ang nursing diagnosis? Alteration in oral mucous membrane. Or mahihirapan tayo sa feeding. There's imbalance nutrition. At samantalahin ko na ang pasyente syempre mag-oral hygiene. Kasi pag hindi siya nag-oral hygiene, problema natin bad breath. There'll be halitosis. Pero gagamitin lang small bristled toothbrush. Small bristled, okay, soft bristled toothbrush. At gagamit ng mouthwash, yes. Pero yun lang, mild oral rinses like oral care. Hindi niya kakayanin yung mga Listerine, mga Bactidol mouthwash, oral care. Okay? Then, about diagnostic findings, client history, review the client's history, symptoms, blood, and bone marrow studies, and microscopic exam, large, immature erythrocytes. Schilling test is the definite test. Okay, board question. The definite test for pernicious anemia is Schilling test. Ano daw ang specimen? 24-hour urine. Okay. It measures the absorption of radioactive B12 before and after parenteral administration of intrinsic factor. Definite test for pernicious anemia. Paano? Radioactive B12 is given orally. Then give IM injection of non-radioactive B12. IM. Collect. Start na. Collect 24-hour urine. Ano yung normal? For vitamin B12 to be absorbed, kailangan natin ng intrinsic factor. Ang vitamin B12, pinainom. Tapos, bibigyan ng injection, B12, to push the radioactive B12 in the urine. Collect 24-hour urine. The urine is negative for vitamin B12. The urine is negative for vitamin B12. Ano ibig sabihin yon sa inyo? Hindi na-absorb sa GIT yung ininom niyang radioactive B12 kasi intrinsic factor. Nakalalamang pernicious anemia. This time, bigyan ng parenteral intrinsic factor. Collect again the urine. And the urine now is positive for vitamin B12. Kaya definite test by to determine vitamin B12 absorption before and after administration of intrinsic factor. Kung hindi na-absorb ang vitamin B12, nasaan lang ang vitamin B12? Nakatenga lang siya sa GIT at ilalabas in the stool pag may pernicious anemia. Okay? Tatandaan. Paano ulit? The patient is given a radioactive B12 oral. Tapos, non-radioactive B12 IM. Collect the urine. The urine is negative for vitamin B12. This time, give parenteral intrinsic factor. Collect again the urine. Oh, the urine is now positive for vitamin B12. Confirm pernicious anemia. Kaya, ano management? Administration of vitamin B12 IM weekly and monthly maintenance. How is it? Vitamin B12, neurobion, a pink solution is given IM araw-araw for 1 week. Araw-araw, 1 week. Then, weekly for 1 month. And then, monthly intervals. Gano'ng katagal? Lifetime. Habang nabubuhay. Kaya, local board question. The definite test for pernicious anemia is Schilling test. Ano daw ang specimen? 24-hour urine. Ano ang definite management? Vitamin B12 IM lifetime. Paano i-introduce? No? So the loading dose, IM daily for 7 days. Then weekly for 1 month. Then monthly lifetime. Okay? Nursing management. Provide a vitamin B12 rich diet. like liver, organ meats, dried greens, green leafy vegetables, citrus, fruits. Avoid highly seasoned coarse or very hot foods kung siya may stomatitis at saka glossitis. Ibig sabihin, bawal yung maasim, maanghang, bawal yung matitigas kasi there'll be irritation of the oral mucosa. Provide mouth care. No? Sinasabi ko, in order to prevent halitosis and another infection, use non-irritating rinses and soft bristled toothbrush. Nakalagay naman talaga doon, soft bristled toothbrush. Okay? And bed rest may be necessary if severe. Okay. Ano nga yung 3 sets of manifestations? 1, secondary to anemia, pallor, weakness, fatigue, activity intolerance, provide bed rest. Pangalawa, GI symptoms. No, GI symptoms, there's stomatitis, glossitis, no? So, alteration in oral mucous membrane. Okay? So, we have to avoid giving hard, coarse diet. No? Avoid irritating rinses. Pangatlo, since there's neurosymptoms, risk for injury. Anong injury? Risk for fall, injury. Risk for burn, injury. Okay. Ayan, vitamin B12, good sources. Especially, kung papipili natin, the best source is milk and milk products, dairy products. Okay? Continue the nursing management. Since there are risks for injury, risk for fall injury, provide safety. Na? So when ambulating, especially if carrying hot items, may dala siyang soup. Di ba, ang soup masarap pagka mainit. Tapos natisod, nadapa. There could be burn, injury. Okay, so provide safety. And then provide client teaching and discharge planning concerning the dietary instruction at yung mga diet, which are good sources of B12. Tapos, lifetime injection of vitamin B12. O baka may paralysis, baka kailangan i-refer siya sa physical therapy. Okay? Another. By the way, kung normal ang stomach, normal intrinsic factor, but the problem lang is the diet. No? So yan yung tinatawag natin vitamin B12 deficiency anemia. Vitamin B12 deficiency anemia. Okay? Pero kung kulang ng intrinsic factor, ada yon pernicious anemia. Okay. Ano yung PADA? Folic acid deficiency anemia. Ito na yung tinatawag nating PADA. Folic acid deficiency anemia. Okay. Para saan ba ang folic acid? Folic acid together with vitamin B12 ay kailangan natin for maturation of RBC. So, pag kulang ng folic acid, magkakaroon din tayo ng abnormal increase in size of the RBC. Kaya megaloblast pa rin. Okay. The manifestations are those of pernicious minus neuro symptoms. Bakit minus neuro symptoms? Because the folic acid does not play a role in normal nerve cell function. Okay, at ito yung main causes of FADA. Poor nutrition, decreased intake, ng mga pagkain na to. Okay, there's malabsorption, like when there's chronic inflammation of the small intestine, like Crohn's disease, o kaya, alcoholic, and the effect of drugs, like anticonvulsants and oral contraceptives. Yung mga gamot daw nito prevent absorption and conversion of folic acid to its active form, leading to folic acid deficiency anemia. Anong assessment findings? So may GI symptoms, beefy red tongue, stomatitis, glossitis. Mayroon siyang fatigue, mayroong weakness, may pallor, okay? Pero walang neuro symptoms. Low hemoglobin hematocrit, low serum folate. And differential diagnosis is Schilling test. Okay? Ano yung differential diagnosis? Again, mag-shilling test tayo. Bigyan siya ng vitamin B12 radioactive oral. Inject non-radioactive B12. Collect the urine. The urine is positive for vitamin B12. That is differential diagnosis. Ibig sabihin, na-absorb naman pala ang vitamin B12. Okay? Kaya lang, hindi ito pernicious anemia. Okay? So may lumalabas na vitamin B12 in the urine. Kaya differential diagnosis. So when asked, anong differential diagnosis for FADA? Shilling test. Anong definite test para sa pernicious anemia? Shilling test. Definite. Dito, differential diagnosis. Okay? Medical management, bigyan natin ng folic acid, oral or parenteral folic acid supplement, a well-balanced diet. Okay. Encourage to eat so bland, high in folic acid. Of course, good oral hygiene nga, no? Kasi meron siyang glossitis, no? Meron siyang inflammation of the oral mucosa. Ayan. Folic acid, folate, or vitamin B9. O, ayan pa rin ang good sources. Beans, legumes, citrus fruits, and juices, dark green leafy vegetables, poultry, pork, shellfish, and liver. A well-balanced diet. Okay. Aplastic anemia. Aplastic anemia. Anong problema? Decrease RBC, decrease platelets, decrease WBC. Kasi ang problema natin ay bone marrow. What are those cells which grow in the bone marrow? Lahat na yan, no? RBC, WBC, platelets, kaya pancytopenia. Pancytopenia. All blood cells which grow in the bone marrow. What are among the causes? There is injury to the pluripotent stem cell. Okay? O kaya, long-term exposure to toxic agents like drugs, chemicals. Ano yung mga drugs na yan? Antibiotic, especially po chloramycetin. Chloramycetin cause bone marrow suppression and bone marrow depression. Okay? Or pwede rin that of ionizing radiation, viral infection, autoimmune, or 50% unknown cause. Okay? Aplastic anemia. So pagka aplastic, isipin mo, pancytopenia, low RBC. Kaya anong findings? Since low RBC, anemia, pallor, weakness, fatigue, activity intolerance, tachycardia. Low WBC, which are our body soldiers. So there's frequent opportunistic infection. Madali siyang maglagnat, madali siyang magubo, madali siyang manya-manya. Low platelets, bleeding tendency, unusual bleeding, petechial, rashes, bruises, coagulation, abnormalities. So hyperactive ang spleen. No? So there's splenomegaly. Okay. So anong result ng CBC? Macrocytic anemia, leukopenia, thrombocytopenia. Okay. Definite test, bone marrow aspiration or bone marrow biopsy. Ayan. So, ayan yan ang concept of bone marrow aspiration. Kuha tayo ng sample, bone marrow cells in the ileum, in the iliac crest. Board question, the most common site for bone marrow aspiration is the ileum. Okay. So, this is the cortex, the cortical bone, ay ang spongy bone, at kukuha ng bone marrow cells by the use of biopsy trocar. Ayan ang itsura natin sa labas. Okay? The use of biopsy trocar. So therefore, class, anong nursing responsibilities if your patient is scheduled for bone marrow aspiration after lunch? You have to obtain consent, explain the procedure, which is the primary responsibility of the doctor, done under local anesthesia. So be sure may skin test na siya sa xylocaine. Request for equipment. Anong equipment? Equipment for skin prep. Anong equipment for skin prep? Like, you had a dressing tray with a pig of forceps, cotton balls with betadine. Okay, baka alam mo sa big hospitals meron silang betadine strip. Hindi yung sa government, No, meron kang bote, no, tapos lalagyan mo ng cotton balls, tapos lalagyan ng betadine. Okay, better na yung betadine strip na meron din silang alcohol swab. Tayo sa government hospital, kuha ka rin ng container, lagyan mo ng cotton balls, tapos lagyan mo ng alcohol. Ayan, whichever. Alright. Tapos, yung dressing tray na yon, meron ng pica forceps, meron siyang cotton balls with betadine, meron kang gauze, may plaster, add-on. At saka do not forget to request for bone marrow aspiration set. Bone marrow aspiration set. Yan ang tawag. Kung nung isang araw, thoracentesis set. Ito naman, bone marrow aspiration set. Na nandiyan na yung biopsy trocar, na yung trocar, tapos may syringes ka din doon, may mga forceps ka, at saka mayroon kang sterile field, or tinatawag nating eye sheet, sterile field. At saka mayroon kang, i-add on mo yung glass slide. Okay. Ano pa? Add on. Ano, i-add on mo. Yun nga yung local anesthesia, xylocaine, tapos the pair of gloves ni doctor. Pero ngayon, pandemic pa rin. Kaya you have to request for PPE at saka face mask. Ganda si patient, naka-face mask. Alright? So ito, naka-side lying position. Get the baseline vital sign. Get the baseline vital sign. Okay? After the procedure, position the patient on his back, turn to affected side. Monitor the vital signs. Bed rest lang muna siya. After 4 hours, pwede na siyang out of bed. Alright? Bone marrow aspiration. Medical management, since there's pancytopenia, kulang ng RBC, WBC, and platelets, bigyan natin ng blood transfusion. What blood component? Whole blood. Whole blood transfusion, preferably fresh, whole blood. But this is discontinued if the client's own marrow begins to produce blood cells. Of course, no? There are risk for opportunistic infection. So, bigyan natin ng antibiotic. If the cause is autoimmune, they are given corticosteroids and immunosuppressants. Definite treatment, bone marrow transplantation. Mainstay of treatment, blood transfusion. Definite diagnostic test, bone marrow aspiration. Definite management, bone marrow transplantation. And of course, identification and withdrawal of offending agent or drug. Kung dahil pala ito sa antibiotic, no? So, kailangang i-weigh natin, tutuloy pa ba natin or hindi. Pero paano maiiwasan? Actually, if the patient halimbawa is having IgA nephropathy, an autoimmune disorder affecting the kidney, di ba, part of the drug therapy is corticosteroids and immunosuppressants in order to suppress the immune reaction. But the client is at risk to develop infection, we have to place on reverse isolation. The drugs, immunosuppressants, corticosteroids, yung mga cytoxan or methotrexate are causing bone marrow suppression and depression. Mag-aplastic anemia ang pasyente. Kaya anong gagawin ng doktor? 3 days after starting on the drug, magsi-CBC na siya. So therefore, the CBC is done about 2 to 3 times a week. From the very start, from the very first time the patient is on drug therapy. Ngayon, kung in 1 week, maganda naman ang blood count natin, so gagawin na lang nila once a week para ma-monitor kung nag-aplastic anemia si patient. Okay? So this is the concept of bone marrow transplantation. This is the donor and ito yung ating recipient. So, the bone marrow cells are harvested. It is drawn from the donor and run through apheresis machine. So the blood is drawn from the donor and run through apheresis machine to extract the stem cells. Tapos ilalagay in a bag and transfuse IV to the recipient. So we have to prepare the patient. The patient receive chemotherapy or radiotherapy to prepare for the new cells which will be given to her. And patient receives the donor cells in an IV. So again, the marrow cells are harvested from the donor and the blood cells pass through the machine para ma-extract yung stem cell. For the meantime, bago ita-transfuse IV, so naka-prepare na rin si patient. So the patient receive radiotherapy or chemotherapy to prepare for the new cells which will be given to her. Okay? Tapos ibibigay nga sa kanya through IV. Kailangan may match HLA typing. HLA is human leukocyte antigen. No? So kinakailangan ay match sila. And usually, the sibling is matched. No? They are 50% chance na match sila. Okay? Kung blood transfusion, ang binibigay natin ay mature cells na agad yun, di ba? Blood transfusion. Tataas na kaagad ang kailang RBC, WBC, and platelets. Si patient, it takes time, about weeks hanggang sa isang buwan. Therefore, ang pasyente stay in the hospital for about 1 month. So the patient is placed in a private room. So dapat lahat ng gagamitin niya are all sterile. He is connected to different machines and equipments para ma-monitor ang kalagayan ng pasyente. Okay? And place on reverse isolation. Anyone with any form of infection should not come in close contact with the patient. So walang visitors walang bisita talaga yan. No visitors na maaari magdala ng infection. Kasi sa panahon ngayon lalo na, no? Walang visitors na pupunta. If ever may kailangan na pumunta, kinakailangan ay rat negative siya. Okay? And dahil panahon pa ni pandemic, lahat, sinong personnel ang pwedeng pumunta, the doctors, the nurse, no, pwedeng pumunta, okay, pero sila ay dapat ay rat negative at rapid antigen test negative, and they must have or must use the gloves, the mask, the PPE, okay? And kung sino man ang may sipon, may ubo, may lagnat, never napapasok dito sa pasyente. Kasi sa patient is still immunocompromised. No? Mababa pa rin ang kanyang RBC, mababa pa rin ang kanyang platelets. No? Kaya we have to conserve patient's energy, provide bed rest, avoid overtiring the patient. Napaka-importante, pinaka-importante is to watch out for opportunistic infection. Yun ang pinaka-importante. Kasi pag si pasyente nagkaroon ng infection, nagkaroon ng pneumonia, pwedeng mawala si patient. Okay? Patient still a bleeder. Kaya we have to observe the patient, gentle handling of the patient. Avoid unnecessary injury, no injection as much as possible. No? If ever there's still a need to give injection, we have to apply pressure a little bit longer than usual. So yung pasyente na nakausap namin, naka-bone marrow transplant, sambuan siya sa hospital, St. Luke's, more than 2 million pesos siya. Okay? So this is the concept of bone marrow transplantation. And nursing management, administer blood transfusion as ordered, that alam nyo na to. The only solution which is compatible with blood, na yung blood will not swell, it will not burst, ay NSS. Ayun, provide nursing care for client with bone marrow transplantation, na isa-isa ko na. Administer medication as ordered. Monitor for signs of infection and provide care, no? Implement special isolation, reverse isolation. Encourage high protein, high vitamins, no? To improve the body resistance and decrease incidence of infection. Mouth care before and after meal. Ibig sabihin, lahat ay gagawin natin para sa pasyente. Monitor for signs of bleeding. Ayan. Use of toothbrush, avoid IM injection, check the urine and the pupo for signs of bleeding. So check ba may oozing gums ba siya, petechial, rashes, and ecchymosis. Ibig sabihin, we have to observe the patient for bleeding, monitor for possible infection, monitor the temperature. Okay. Ayan. No? Okay? Anong pinaka-importante? Watch out for infection. Patient placed on reverse isolation. Next. Bago tayo pumunta din sa hemolytic anemia, earlier I mentioned, pagka si renal failure ay chronic renal failure is unable to produce the needed hormone erythropoietin. Erythropoietin will stimulate the bone marrow to produce RBC. Kaya si renal failure, magkakaroon ng anemia. Yun ang tinatawag na anemia renal in origin or secondary anemia. Siyempre, pallor. Yes, pallor. Pero since renal failure, the waste products of metabolism are excreted in the skin. Kaya hindi mo nga makikita yung pallor nila. Anong color nila? Gray color. Maputlang, mag-gray. In short, like one description ng pasyente, ako ay parang buhay na bangkay. Maitim. Wala kang makikita ang kasing ganda ng kutis ko, kasing ganda ng kutis nyo. No? Kasi nag-aagaw yung putla at saka yung gray colored. May anemia. Ang kailangan natin, blood transfusion. What blood component? Packed red blood cell. At saka erythropoietin injection. Kasi yun naman talagang kulang niya, erythropoietin. Kung ang dialysis 3 times a week, edi 3 times din mag-inject. Kung severe type of anemia talaga, double dose ang erythropoietin. Wherein the erythropoietin costs about 1,200. Pero may generic naman na about 900 pesos. Okay? Paano ibibigay yung erythropoietin? through the tubing na ginagamit during dialysis. Bago mag-end yung dialysis. Pero yung erythropoietin baka nasa tubing lang ng dialysis tubing. Kaya they really suggest to be given sub-Q. Lahat ng pasyente na binibigyan ng erythropoietin, napakasakit pala nito talaga. Kaya talagang facial grimacing, halos kagutin nila ang labi nila pagka sila binibigyan ng erythropoietin injection. Okay? At kung mababa pa rin, kailangan niya ng blood transfusion, only packed red blood cell. At pag binigyan ng blood transfusion during dialysis. Kasi nga, hindi ba, kidney failure, unable to regulate the fluid volume. Kaya kailangan ibigay during dialysis. Alright. Next, hemolytic anemia. Anemia caused by increased destruction of RBC. Okay. Na meron tayong dalawang klase, acquired and hereditary. Okay. Ano yung acquired? It develops anytime after birth. While hereditary, that is congenital. No? At birth, meron na siya niyan. Like hereditary spherocytosis, G6PD deficiency, sickle cell anemia, thalassemia. Hindi na natin di-discuss ito kasi ito talagang topic nyo sa pediatric nursing 219. Okay, but anyway, acquired, no? Halimbawa, si pasyente ay may coronary artery disease, no? May bara sa coronary artery na hindi effective yung PTCA, percutaneous transluminal coronary angioplasty, kaya nag-cabbage. Kinapit ang pasyente sa cardiopulmonary machine. So, yung dugo hindi papasok sa right atrium to the superior vena cava habang nag-oopera, habang nagba-bypass. So, the blood will go to a machine, no? Na yung machine na yun ang mag-gas exchange. Habang ang dugo, pass the tube, nade-destroy ang ibang blood cell. Kaya nagkakaroon ng premature destruction of RBC. O kaya, may disseminated intravascular coagulation, na topic natin mamaya, that there are two conflicting forces na maraming blood clot sa blood vessel, tapos nagbi-bleed ang pasyente. So maraming blood clot, nasisira ang mga blood cells. Or dili kaya, secondary to toxins and hazardous chemicals, or when the patient is given a blood transfusion, nagkaroon siya ng hemolytic reaction, nagkaroon ng incompatibility of patient's blood, na yung donor blood sinisira ng antibodies ni patient. Kaya nahihemolize ang red blood cell. Okay. So what are the signs and symptoms? The clinical manifestations vary depending on the severity of anemia and the rate of onset, whether acute ba or chronic. But chronic type, there's dyspnea pallor, fatigue, there's jaundice. Na, di ba? The end product of RBC destruction is bilirubin, kaya may jaundice. There could also be fever, chills, irritability, and precordial pain. There's also abdominal pain, nausea, vomiting, diarrhea, melena, no? And splenomegaly, kasi overfunction ang liver and spleen. Kaya there's hepatomegaly, splenomegaly, or organomegaly, and symptoms of cholecystitis because there is increased production of bilirubin. Nagkakaroon ng change in composition of bile. Whenever there's change in composition of bile, then there will be gallstone. Ano ba yung composition of bile nga? It consists of bilirubin, bile salts, calcium. There is premature destruction of RBC, kaya there's increase in bilirubin. Eh, what type of stone? Pigment stone, bilirubin stone, that it can cause obstruction to the common bile duct at si pasyente magkakaroon ng abdominal pain. So there could be bleeding. Okay? So, laboratory test, syempre mababa pa rin ang hemoglobin hematocrit. Ngayon, there be body compensation, increased production of reticulocytes. Di ba, reticulocytes, sila yung nagmamature into red blood cell. Coombs test, positive if autoimmune features are present. Ano yung Coombs test? It detects antibodies that are stuck to the surface of RBC. May antibodies na nakakabit, nakastuck to the surface of RBC. Yun ang positive Coombs test. It's really autoimmune cause. Okay? And of course, there's increase in bilirubin, hyperbilirubinemia. So medical management, identify, eliminate the cause, if possible. Administration of corticosteroids, if autoimmune. Bigyan ng blood transfusion. Okay? And if it fails to respond to medical treatment, then splenectomy. The nurses monitor for signs of hypoxia, including confusion, cyanosis, tachycardia, and palpitation. All right. Continue. If jaundice and associated pruritus are present, avoid soap during bathing and use cool or tepid water. Frequent turning and meticulous skincare are important as skin friabilities increase. No? So as much as possible, advise not to scratch. No? If ever makate, kakamot, ito lang gagamitin palad. No? So palad lang gano'n. No? Hindi yung kuko, hindi kuko kakamutin ng ganyan. Uy, naku, nagadugo-dugo na siya. Tsaka lang siya titigil sa scratching. Okay? Moving on. The process of hemostasis and blood clotting. We will now be reviewing the role of the platelets and clotting factors with blood clotting and coagulation. Blood clotting involves three sequential process. Ano yun? Platelet aggregation with formation of platelet plug, blood clotting cascade, and formation of complete fibrin clot. So ano daw yung three sequential processes? One, platelet aggregation with formation of platelet plug. Pangalawa, blood clotting cascade. Pangatlo, formation of complete fibrin clot. Ito yung blood vessels. Ano yung outer layer? The outer layer of the blood vessel is tunica adventitia. The middle layer, tunica media. Inner layer, ayan ang inner layer. The inner layer is smooth because it is lined by endothelial cells. Tunica intima. Inside the blood vessel are the blood, which consists of the cellular elements and plasma, RBC, platelets, at saka yung ating WBC. How? May injury tayo. When there's injury to the endothelium, when there's injury to the blood vessel, akat, nahiwa, o kaya tinusok natin, no, for IV therapy or blood transfusion. Di ba may bleeding? Okay? There's a bleeding because of injury. There's damage to the endothelial cells. Kasunod ng bleeding, magkaklat, di ba? Pero bago yun, take a look at the platelets. Ang platelets, iwahiwalay sila. Pero pagka may injury, they start to go closer to one another. So that is called platelet adhesion. Okay? So they go closer to one another. That is platelet adhesion. Then, there is the platelet release reaction. So there's release, there's liberated ADP, serotonin, thromboxane, calcium. So the platelets to one another, nagdikit na sila, and there's release of serotonin, thromboxane, calcium. That is called platelet release reaction. And tingnan mo, there's already platelet aggregation. They come on top of one another. Nagpatong-patong na sila. So that is called platelet aggregation with formation of platelet plug. Diba? Ito yung endothelial cells, ito yung kabila, ito yung endothelial cells. Nasira ito eh. Nasira endothelial cells. Ano ngayon ang ginawa ng platelets? Nagdikit-dikit na sila? There's formation of platelet plug which temporarily support the destroyed blood vessel. So yun ang there's formation of platelet plug. So ano yung reaction? They come closer to one another? Platelet adhesion. Then there's platelet release reaction, platelet aggregation with formation of platelet plug. Ito ngayon ang mag-i-initiate ng blood clotting cascade. Dito, nagte-take effect si aspirin. Dito nagte-take effect yung ating Plavix, clopidogrel, anti-platelet aggregation. In layman's term, blood thinning, pampalabnaw ng dugo. Okay? Kasi si patient is at risk to develop blood clot. Next, ayun, platelet plug triggers the blood clotting cascade mechanism through intrinsic pathway and extrinsic pathway. I hope nare-recall nyo yung anatomy, physiology nyo. So ano yung intrinsic pathway? The stimuli, nasa loob. Intrinsic factors are problems or substances directly in the blood that first make the platelets clump and activate the blood clotting cascade. Example, antigen-antibody reaction. Okay, may circulating debris. Okay? Okay, may prolonged venous stasis. Yung pasyente bedridden, hindi gumagalaw, paralyzed, no? O kaya may toxins, no? May toxins sa dugo. Okay. So yan ang intrinsic pathway. While extrinsic pathway, the stimulus is outside the blood. Na halimbawa ngayong may trauma, nasaksak na baril. At kailangan natin ng hindi lang platelets, pati clotting factors. So the liquid portion of the blood, yellow portion, the plasma, contain the clotting factors. So na yung factors na yan. Fibrinogen, prothrombin, calcium, tissue thromboplastin, proaccelerarin, proconvertin, 8, anti-hemophilic factor, Christmas factor. Pag kulang ng anti-hemophilic factor, kulang ng Christmas factor, yan yung sinasabing classic hemophilia. Okay? Pag kulang ng factor 8, yun yung hemophilia will have bleeding disorders. Anyway, each clotting factors have a role na nagtutulungan sila with one another. Like, damotong si prothrombin. Factor 2 is inactive precursor of thrombin. Prothrombin is activated to thrombin, meaning prothrombin is inactive. Ang active form niyan, thrombin. Pero kailangan niya si Stewart factor. Kailangan niya si Stewart factor. Kailangan niya si factor 10. After it is being activated, thrombin convert fibrinogen to fibrin. Kaya nagkakaroon tayo ng blood clotting. In short, it's nice to know the different clotting factors at ano ang mga trabaho nila. But you must know, for blood clotting to happen, kailangan natin ng clotting factors na ito para magkaroon ng blood clotting through intrinsic pathway or extrinsic pathway. Ito yung intrinsic pathway. Diba? There is venous stasis. There are circulatory debris. Mayroon tayong bacterial toxins. Yan ang mga intrinsic stimulus eh. There is platelet aggregation. Diba? Ano yung platelet aggregation nga? There is a platelet addition, release reaction, platelet aggregation, and it stimulates blood, it stimulates formation of platelet plug. Tingnan mo. Kailangan ng factor 12. Factor 12 is inactive. It will be activated to factor 12A. Factor 9 is activated. No? Factor 9 is activated. Factor 9 needed para ma-activate si factor 10. Si factor 10, kailangan natin yan to convert prothrombin to thrombin. And thrombin will convert fibrinogen to fibrin. Kaya magkakaroon tayo ng blood clotting. Anong clotting factors sa kailangan? Factor 12, 11, 9, 10, factor 2. Prothrombin, and fibrinogen, factor 1. Kailangan natin ng clotting factors, kaya magkaroon tayo ng blood clot. Kaya pag may injury, mag-bleed at magba-blood clot. Paano yung extrinsic pathway? Halimbawa, trauma. Ano ang mga factors na kailangan natin? More on factors 7. Of course, kailangan natin ng platelets, calcium. Ayan, no? So, kailangan din niya ng factor 10. Factor 2, factor 1 para magkaroon ng blood clot. Protective in nature. Para hindi ka mag-severe bleeding. Pero halimbawa, blood clot in the coronary artery, anong effect? Blood clot in the coronary artery will obstruct blood flow to the heart. Kaya magkakaroon siya ng myocardial infarction. Because there is a blood clot, oxygen is delivered to the heart muscle. So the heart muscle die. Ano ibibigay natin to dissolve the blood clot? Ito yun. So, kailangan mo ng thrombolytics or saan mag-i-effect in thrombolytics? It will directly dissolve the blood clot. So there'll be clot lysis, fibrin split, no? Products. So ibig sabihin, anong gamot bibigay natin? TPA, tissue plasminogen activator, o kaya streptokinase, urokinase, ano pa? Retaplase. It will directly dissolve the blood clot. How would you know? The thrombolytic is obtaining its therapeutic effect, nawala yung chest pain. Ibig sabihin, patent na yung coronary artery. Pero dapat may bigay within 6 hours yung thrombolytics. Okay, thrombolytics take effect dito. It will directly dissolve the blood clot. Yung ating antiplatelet aggregation, ayun, no? Aspirin, platelets, antiplatelet aggregation, take effect dito to prevent platelet aggregation, blood thinning. How about heparin? Heparin take effect here. Heparin prevent or inhibit conversion of fibrinogen to fibrin by enzyme thrombin. Yun ang heparin and heparinoids. Anong tawag? Anticoagulant. Okay? So ito yun. So, ang exact MOA, heparin will inhibit conversion of fibrinogen to fibrin by enzyme thrombin para hindi mag-blood clot. Anticoagulant. But it has no ability to directly dissolve the blood clot. How about warfarin or Coumadin? It inhibits the synthesis of vitamin K dependent clotting factors like prothrombin 2, that is factor 2, 7, 9, and 10. Okay? So ito yung effect ni Coumadin or warfarin sodium. Kaya ilan ang klase anticoagulant natin? Heparin at saka Coumadin. Alright? So, pagka may damage, okay na mag-blood clot. Pero kung may blood clot na bumabara sa blood vessel, there'll be necrosis. Kaya kailangan i-dissolve ang blood clot by giving thrombolytics or promote or prevent future blood clot. Bibigyan natin ng anticoagulant. But the side effect is bleeding. Observation for bleeding. So for blood clotting to happen, anong kailangan mo? Normal amount of platelets and normal clotting factors. Kaya pag kulang ang clotting factors, like yung hemophilia, pwede bibigyan natin ng clotting factors. Bibigyan natin ng plasma, fresh, frozen plasma. Okay, bibigyan sila ng cryoprecipitate. Okay? Disorder 1. ITP. ITP stands for idiopathic thrombocytopenic purpura, ITP, or can be called autoimmune thrombocytopenic purpura. Idiopathic, unknown cause. Thrombocytopenia, mababa platelets. Mababa sa 150,000. Purpura, nagkaroon ng extravasation of blood into the tissues. So, autoimmune, the exact cause is unknown, pero probably it is autoimmune na may antibodies against own platelets na nasisira ang platelets. Ayun, there's destruction of platelets causing a slow blood clotting process. And the cause is autoimmune. Kaya sinabing autoimmune thrombocytopenic purpura. There are autoantibodies. There are antibodies destroy the body's own platelets. Antibodies directed towards own platelets. So, ano assessment findings mo? Platelets. Dadaling intindihin, bleeding anywhere. Bleeding anywhere. Ecchymosis, bruises, marami siyang pasa-pasa, marami siyang petechial rashes, no? So sa legs, upper chest, and neck, mucosal bleeding, gum bleeding, nose bleeding, GI bleeding, vaginal bleeding, urinary system bleeding, hematuria, or intracranial bleeding. So with significant blood loss, magkaroon tayo ng anemia. Significant blood loss, hemorrhagic anemia. Intracranial bleed, so nagdugo dito, Tapos yung dugo na blood clot na, di ba? Nag-bleed, nag-blood clot. It occupies space in the cranial cavity. So there'll be signs and symptoms of increased intracranial pressure. Kaya, ano ang signs and symptoms? Increasing ICP, there's paralysis, altered level of consciousness. Kaya we have to assess neurologic function. Assess Glasgow Coma Scale. Okay. Ayan, pinpoint. Pinpoint hemorrhages. No? Yan ang tinatawag natin petechial rash. O mga pasa-pasa, hematoma. Diagnostic findings. Low platelets. Large amount of megakaryocytes. Di ba ito yung young, immature platelets, megakaryocytes. And presence of antiplatelet antibodies. Because of bleeding, ay di ba baba na yung hemoglobin, hematocrit, medical management, and the treatment of underlying condition and protection from trauma-induced bleeding episode. Autoimmune cause, bigyan ng corticosteroids and Imuran or azathioprine. Pero patient, it suppresses immune function, risk for infection, place on reverse isolation, practice good hand washing. Okay? Platelet transfusion, kasi yun naman ang main cause talaga eh. Di bigyan natin ng platelets, no? Pero sabi, it is not routinely done because they will be destroyed also. Pero kahit pa paano, ma-replace natin. Initially, bibigyan natin ng platelets. Pero isa ba, bigyan natin ng immunosuppressants at bigyan natin ng corticosteroids. No? Kumbaga sabay yun. No? Hindi yung bigay ka lang ng bigay ng platelets, i-destroy din yan ng antibodies. Maintain a safe environment. Protect the client from conditions that can lead to bleeding. Provide safety, gentle handling of the patient. Control bleeding. How? Kung saan ba, nose bleeding, depress the nose. No? O kaya gum bleeding, bigyan mo siya ng ng ice chips. No? GI bleeding, mag-gastric lavage. Ayun, control bleeding. Apply pressure to the site as needed. Position bleeding part above heart level if possible. Administer platelets as ordered. Pag nagbigay tayo ng platelets, fast drip. All right. Prevent bruising, gentle handling of the patient, huwag panggigilan ang pasyente, and provide support to the client and be sensitive to change in body image. One of the diagnosis is alteration in body image. Another, high risk for bleeding, high risk for injury, risk for bleeding. Marami siyang pasa-pasa. Pasa-pasa. Okay, naka-ano siya, so may support siya dito sa sa leeg o kaya pasa-pasa sa kamay. Kaya kahit mainit ang araw, nakalong sleeves siya. Huwag mo nang tuksuhin. Oy, ano ba yan? Katirik-tirik ng araw, tapos nakalong sleeves ka. Okay, parang may tinatago ka sa leeg mo. Huwag mo nang tuksuhin. Kasi nahihiya na rin naman yung pasyente. No? Kaya you just provide support. Okay? So because there's alteration in body image. Siguro sinuntukan na naman ang boyfriend mo. Hindi naman. Kasi ito, walang history of trauma ito ha. Na nagpasa-pasa, walang history of trauma. Spontaneous bleeding. Spontaneous bleeding ito. Okay, continue with the intervention. Okay, administer medications, no? As much as possible. Avoid parenteral injections. If there's a really a need not to give IM injections, you have to apply pressure a little bit longer than usual. Okay, so usually about 5 minutes. Ayan. Okay, now, if kailangan niya ng analgesic, no, bigyan ng acetaminophen, no aspirin. Kasi nga si aspirin is antiplatelet aggregation. Okay? DIC. Ano yung tinatawag natin DIC? DIC is disseminated intravascular coagulation or disseminated intravascular clotting. Ano to? There's diffuse fibrin deposits within arterioles and capillaries with widespread coagulation all over the body and subsequent depletion of clotting factors. Ibig sabihin, maraming blood clot sa mga blood vessels, cerebral artery, sa may coronary artery, renal artery, marami, widespread coagulation. Nagamit ng mas mabilis ang clotting factors. Kumbaga, out of supply na ang clotting factors. Kaya kasunod, massive bleeding. Pero mo, Two opposing forces, widespread clotting, widespread blood clot, tapos may hemorrhage in the kidney, brain, adrenals, heart, and other organs. Kaya mahirap gamutin. Two conflicting forces. And the exact cause is unknown. Pero clients are critically ill with obstetric condition. Kailan yon? Pregnancy-induced hypertension, toxemias of pregnancy. You will observe this in toxemias of pregnancy, eclampsia and pre-eclampsia. Okay, surgery. So, yung mga ka-opera lang. Hemolytic, hemolytic disease or cancer. May chronic infection. Chronic infection like chronic pancreatitis. Okay? Neoplastic disease. May be linked with antithromboplastic substances into the blood. Mortality rate is high. Usually, because underlying disease cannot be corrected. Kasi pagka may blood clot, di ba bibigyan nga natin ng thrombolytic, anticoagulant. Kaya lang, may hemorrhage naman Paano mo may bibigay yun? Anong bibigay natin? So supportive management pa lang ang bibigay natin. Ayan ang itsura ng pasyente. Eyes, natulo, sa mata, dugo. Ilong, tulo, dugo. Naka-endotracheal tube, nasa suction mo, blood. Lumalabas sa bibig, natagas, dugo. Okay. NGT, may blood rin. Okay. Pag sinuction mo, masasuction mo, blood. Tingnan mo, ang dami niyang pasapasa dito sa katawan. Marami siyang hematoma, ecchymosis. Tapos, tingnan mo yung Foley catheter. Ang Foley catheter, renal shutdown, decrease urine output. If ever may urine output, dugo, hematuria. Patient is in coma, comatose. Okay? So, yeah, we had a patient, husband ng ating faculty, na nagkaroon ng DIC. Husband niya, malakas, hindi nagkakasakit. Pero ang history lang niya, meron siyang, alcoholic siya. Iba daw uminom si Sir. Bakit ibang uminom? Siyempre, nandiyan mga kaibigan, inuman tayo, may birthday, may occasion, ganyan-ganyan. Pagkatapos, paggabi na, o ating gabi na, uwian na. Pero siya hindi pa uuwi, iinom pa siyang mag-isa. Okay? So, ilang known data, alcoholic. Otherwise, wala na siyang ibang sakit pa. Hindi nga smoker pero alcoholic. Pero one time, nag-LBM siya. Ayaw pa hospital, dadali na ni ma'am sa hospital para magamot ayos. Pero ayaw niya, kaya pumayag na mag-IV fluid therapy sa bahay. So yung hapon na yun, nag-IV fluid therapy sa bahay, inserted by the kapatid. Si kapatid is doctor medicine. Pero at about 8 p.m., sige-sige pa na nag-LBM siya, 3 more episodes. Tapos sabihin ng hinana, kaya pumayag na rin na dalhin sa hospital. So dinala sa hospital dyan sa Malolos Government Hospital kasi doon siya nag-duty. Pero disappointed din siya kasi mabagal yung management. Kahit sabing kilala niya yung bang doktor doon. Kaya dinala sa private hospital. Dinala sa private hospital. Sa Malolos din. Doon naman ako hanga doon sa private hospital na yon kasi ang bilis ng diagnosis nila. Ma'am, para pong DIC, Disseminated Intravascular Coagulation. So, ilalagay po natin sa ICU. ICU, kung ICU, ay parang malaking gastusan ito. So, transfer ko na lang po sa Fatima. So, from Malolos to Fatima. At least kasi sa Fatima, hindi problema yung gastos, kasi pwedeng may discount syempre, at saka pwede SD, salary deduction. In short, nakadating sila by ambulance sa Fatima 3 a.m. And the client had the first arrest sa ER. Pero na-revive, 3 a.m. arrest, na-revive. And nung stabilized na yung vital sign, was transferred to 4th floor of ICU. nag-rest alas 3. Nabalitaan na namin yun. Tawag siya sa akin. Kasi faculty under level 3. Alas 7, nandun ako sa ospital. Tapos ganyan-ganyan ang itsura niya. Talagang unresponsive. At ganun talaga. Yung IV site niya, alam mo po ang tumatagas, dugo. Tapos andun ang mga fourth year. Andun ang mga fourth year students assigned in the ICU. Tapos, no, so lapit sila sa akin, ma'am, natatakot po kami. Bakit ayaw yung isaksyon? Natatakot po kami, baka mapagalitan po kami ni ma'am. Yung CI, hindi naman. O kasi pag sinanksyon daw nila, nakukuha nga blood. Okay? So ibig sabihin talagang what we can do, halos wala na tayong magagawa because the management is controversial. So actually, ano nangyayari? Pathophysiology, simpleng maintindihan. So underlying disease, it could be toxemia sa pregnancy o kaya ay cancer na si patient ang nakita no, sa CT scan ay meron pala siyang chronic pancreatitis. So saan niya nakuha yung chronic pancreatitis? Chronic infection because of alcohol abuse. There's release of thromboplastic substances that promote blood clot deposition throughout the microcirculation. Ibig sabihin, ang daming blood clot, microthrombi, causing microinfarcts and tissue necrosis. Tapos, no, platelets, the RBC are trapped, no, platelets, prothrombin, and other clotting factors are destroyed. Nagamit na ng mas mabilis ang clotting factors, kaya nagkakaroon siya ng severe bleeding. Excessive clotting activities activates the fibrinolytic system, which inhibit platelet function, causing further bleeding. Okay, so assessment findings. Ayan nga, no, petechial rash, ecchymosis, no, on the skin, on the mucous membrane, on the heart, lungs, and other organs. Okay. Yan, Apo. Andito si Apo ko. Naku. Kamaingay, nagli-lecture si Lois. Sorry po. What? Ito lapis mo. Okay. Sorry po, naglalambing si Apo. So there's prolonged bleeding from breaks in the skin sa IV. Ano pa? There's severe and uncontrollable hemorrhage during childbirth. Ito yung mga may toxemia sa pregnancy. There's abnormal vaginal bleeding. Anong effect on the kidney? Siyempre, pagka nag-bleed na siya, okay, there is altered renal perfusion. There's renal shutdown, oliguria, and anuria. Halos walang urine output. Kung meron man urine output, hematuria pa. Gross hematuria. And convulsion, coma, and death. Prognosis is very poor kasi nga management is controversial. So the patient is already unresponsive and comatose. Dumating na kami doon, alas 7. And then, unfortunately, the patient died at about 11 a.m. Diba? Dinala sa hospital, alas 8 ng gabi. Tinransfer sa Fatima, nakarating alas 3. Noon lang siya na hospital. Kaya napakasakit para sa pamilya. Okay? Na hindi siya madaingin, hindi siya mareklamo. Yun nga lang, no, na siya ay mahilig uminom. Na nagkaroon siya ng chronic pancreatitis. Hindi niya alam din na may pancreatitis siya. Laboratory findings, prothrombin time, PTT, thrombin, prolonged. Tapos fibrinogen level, platelet count, depressed. Factor assays 2, 5, 7, depressed. There's depressed clotting factors. Medical management. Identification of control of underlying disease is the key. Kumbaga, bigyan lang ng blood transfusion. Any blood component available sa hospital. Like whole blood, pack RBC, platelets, plasma, cryoprecipitate, volume expander. Pero hindi na binigay sa pasyente kasi alam na nila useless na lang. So kumbaga supportive measures. Naka-NGT, hindi naman mabigyan ng feeding kasi may dry bleeding. Pero naka-endotracheal tube, no, at connected to respirator. Heparin, controversial. Hindi nga natin mabibigay kasi there is bleeding. So, monitor blood loss nurse and attempt to quantify, meaning monitor intake and output, observe for additional bleeding or thrombus formation, monitor appropriate laboratory data, prevent further injury, avoid IM injection, apply pressure to the bleeding site, gently turn and position client frequently, provide frequent non-traumatic mouth care by the use of soft toothbrush or gauze sponge, provide emotional support to the client and significant others. Kung wala na tayong magagawa sa katawan, at least we provide spiritual care. Importante, no? Mabigyan siya ng last sacrament. Kumbaga, it has moral lesson. We have to consider every day as our last day. Siyempre, mga bata pa kayo. Hindi pa nyo naiisip yung mga bagay na yan. Wala pang isip sa inyo yung mga morbidity and mortality. Pero yun ang fact, no? Consider every day your last day. Si Lord lang talaga nakakaalam, no, kung hanggang saan tayo. Pero alam ko, magtatagal pa kayo. You will graduate on time. Take the board exam on take 1. Okay? So yan ang goal natin, ha? Lahat papasa. Okay? Graduate on time. Pass the board on time. At masapul nyo yung demand for nurses, not only local, but also global. Ayan, so good luck sa ating lahat. Good luck sa inyong lahat. Okay? Administer blood transfusion and medication as ordered. Okay? Question? Bago tayo punta dito sa blood vessel, wherein the blood vessel must be patent, it must be elastic. Question? Okay, kung wala question, what about the blood vessel? Diseases of the blood vessel is hypertension. Hypertension, with new classification given by JNC during the 7th report, the normal adult BP is less than 120 systolic and less than 80 diastolic. Okay, 120 to 139 systolic, 80 to 89 is considered pre-hypertension, while a BP of 140 to 159 and diastolic of 90 to 99 is stage 1, while a BP of 160 over 100 mm mercury is stage 2 hypertension. Pero may new classification na tayo by JNC during the 8th report. By the way, ang JNC is Joint National Committee on Diagnosis, Management, and Rehabilitation of Hypertension during their 8th report. Ito na yun. Normal, BP, less than 120 systolic, less than 80 diastolic. Elevated na ang tawag pagka 120 to 129 systolic and then less than 80 diastolic. Stage 1, 130 to 139 systolic, 80 to 89 diastolic. Stage 2, 140 or higher, 90 or higher diastolic. Hypertensive crisis na yan. Hypertensive crisis na pagka 180 systolic and about 120 diastolic. Okay. And what are the classification? The classification of hypertension. Kanina is stage 1, stage 2 hypertensive according to BP reading. Ngayon, types of hypertension according to etiology. According to etiology. Essential, no known cause. 90% of the cases of hypertension is essential or primary. Secondary, no, due to specific disease states and some medication. 10% are secondary. 90% essential. No known cause, pero it is associated with aging, 60 years old above, passive family history, excessive calorie consumption, inactive, alcoholic, hyperlipidemia, common in African American ethnicity, high intake of salt, mahilig sa caffeine, obesity, smoking, stress. Essential hypertension. Yan yung secondary. Secondary to diseases like renal vascular disease. Ibig sabihin, renal disease, may sakit sa kidney. You know that the kidney play a role in regulation of the blood pressure through RAAS, renin, angiotensin, aldosterone system. So the kidney regulate fluid volume and pressure. Kaya pag may kidney disease, magkaroon ka ng renal hypertension. Secondary. O kaya, primary aldosteronism. Aldosterone is produced by the adrenal cortex. Adrenal cortex aldosterone is mechanism of action? Sodium and water reabsorption, increasing the fluid volume, increasing the blood pressure. Pheochromocytoma, a tumor of adrenal medulla. What are the hormones secreted by adrenal medulla? Hormones secreted by adrenal medulla. We have the catecholamines. What are the catecholamines? We have the epinephrine and norepinephrine. Sympathetic nervous system stimulation, increase in blood pressure. Ano pa? Cushing syndrome. Cushing syndrome is a disease which affects the adrenal cortex, wherein there's increase not only aldosterone, but also glucocorticoids, which raises glucose level, as well as sex hormone. Okay? So kumbaga, and some another causes, medication like glucocorticoids, tataas ang blood pressure. Mineralocorticoids, hypotomimetics, tataas ang blood pressure. Secondary. Pero most common type, 90% is essential, no known cause. According to prognosis, blood pressure can be classified as benign or malignant. Kung blood pressure niya ay ganito lang, 140/90, 150/99. Pag ang blood pressure nagsushoot up to 200/120, pag 180, malignant. Yun ang malignant. Usually, bakit nagsushoot up? Non-compliance with the prescribed medication and diet therapy. Okay? Kaya poor prognosis. Dahil pag sobrang taas, there could be a rupture of the blood vessel. Patient can have hemorrhagic stroke. So anong assessment? Nurse, take the history. Review client's risk factors for hypertension. Yung ating risk factors dito, no? Sa kaliwa. And physical assessment, most clients have no symptoms. Most clients are asymptomatic. However, they may experience headache, dizziness, fainting. Check for orthostatic hypotension. A decrease in BP of 20 mm mercury systolic or 10 mm mercury diastolic with a change of position from lying to sitting in 2 minutes interval. Board question. To prevent orthostatic hypotension, si pasyente nakahiga sa bed. Allow the patient to sit up on bed, at the edge of the bed, for about few minutes. Paupuin bago lalagay sa chair, bago lalakad. Hindi yung from bed, talon agad siya on the floor. There could be orthostatic hypotension. Sino magtatakicardia, sweating, pallor? Kung ang pasyente ay may pheochromocytoma. Diba? Ano nga yun? Pheochromocytoma at tumor of adrenal medulla, wherein the secretion of epinephrine and norepinephrine is sympathetic stimulation. Kaya mag-tachycardia, sweating, pallor. Otherwise, asymptomatic yung ibang pasyente. Psychosocial assessment. Assess for psychosocial stressor. Ano po ba ang trabaho mo? It could be related to economic and other life stressors. Ang dami niya talagang stress. Kasi kumbaga, president of the Philippines, president of the university, o kaya may negosyo sila, tapos because of the pandemic, nalulugi sila. Ay, sobrang stress yun. Kaya na-hypertension siya. Yun, psychosocial assessment. Anong diagnostic? No laboratory tests are diagnostic of essential hypertension. But several laboratory tests can assess possible cause of secondary hypertension. Like simple urinalysis, simple urinalysis and BUN creatinine. Pagka ang urinalysis, may hematuria, pyuria, may proteinuria. Oh, renal problem pala siya. Renal hypertension. Mataas ang BUN creatinine. Meron pala siyang renal parenchymal disease. Secondary. At chest x-ray natin. Pag may chest x-ray, di ba? Pag mataas ang blood pressure, there'll be increase in heart workload. Ma-increase in heart workload after load. May fluid overload, increase in preload. Magko-compensate ang puso by enlargement, the cardiomegaly. And ECG determines the degree of cardiac involvement. Okay? At saka, hindi mo matatag na ang pasyente ay hypertension, isang beses mo lang kinunan ng blood pressure. Siyempre, yung isa may phobia sa blood pressure. Makakita lang siya ng blood pressure ay ang taas ng kanyang reading. Ay phobia. Hindi pagpahingahin mo muna siya. Pagpahingahin mo muna. I recall din, no, yung hipag ko, nung siya ay pregnant. Alam mo po, pupunta siya sa clinic. Okay? Pupunta siya sa clinic, tumataas ang blood pressure niya. Kasi sasabihin, Mrs., baka po masesaryan ka. Parating iniisip cesarean, takot nga ang tao sa cesarean section. Kaya ginawa niya, lumipat na lang siya ng OB. Paglipat naman niya sa OB, no, talagang ang bait naman ni OB, normal ang blood pressure niya. Kasi wala yung fear doon na baka ma-CS siya. At, okay, kaya kailangan in one, halimbawa nagpa-check up ngayon, kunan ng blood pressure 2 to 3 times kung talagang mataas. Or better still, submit the patient for 24-hour BP monitoring. Kung tayo ay may 24-hour ECG, this time, 24-hour BP monitoring. Na yung BP half nakakabit sa pasyente 24 hours. Ang tawag, 24-hour BP monitoring, covered po yun ng PhilHealth. So therefore, si pasyente as admitted in the hospital for 1 day. So the BP apparatus, no, ay nakakabit sa braso and automatic, no, it will inflate and will do the reading hourly on the hour. Ibig sabihin, may BP reading siya 24 times. 24 times. Na habang may bisita, kumakain, natutulog, nagpapahinga. O yun ang most accurate BP monitoring. Kung tinanggal siya ng alas 8, kinabit ng alas 8, na? So dapat naligo ka na. Naligo na ang pasyente. And the reading will be done. Sabi ko nga, every hour on the hour. Everything can be done except maligo, no? Kasi hindi pwedeng basain yung apparatus na yun. Alright? So makikita. Ma'am, sabi mo, marami ka lang stress sa school. Pero dito po, base dito sa reading, no? So out of 24 hours, 24 reading, 16 hours po ay mataas. Meron pa rin po dito 1 a.m. Nag 200 ka po ng 1 a.m. So hindi na pwedeng i-deny na talaga palang meron kang hypertension. Pero wala namang renal disease, wala namang ibang sakit. So therefore that is primary hypertension. Okay? Kaya maggamutan na tayo. Intervention, lifestyle modification. Siyempre, by the way, what are the 3 processes na nangyayari? Bakit may hypertension? 1, increase in fluid volume. Pangalawa, sympathetic stimulation. Pangatlo, increase peripheral vascular resistance. Kaya nagkakaroon ng hypertension. Okay? So therefore, lifestyle modification, low sodium diet, weight reduction, especially obese, and BMI is 25 or higher. Moderation of alcohol intake because it elevates the blood pressure. It can add to empty calories lang. Regular exercise. Start an exercise program slowly and gradually work up to more rigorous activities. So dapat yung exercise na mga 20 to 30 times in 20 to 30 minutes, about 3 times a week. Na pinawisan ka talaga at nagtatakicardia. Yun. A good exercise. Of course, stop smoking. No? Ayan yung mga lifestyle modification. And drug therapy, the drug of choice is diuretic. So diuretic like furosemide, especially for clients with hypertension, na may asthma, CAL, and chronic renal disease. At ano ito? Itong ating loop diuretic like furosemide. Pero ano ang side effect ni furosemide? A furosemide, anong effect? It inhibits the absorption of sodium and water in the loop of Henle, but there will be excretion of potassium. Kaya side effect, hypokalemia. So monitor serum electrolytes. Kung bumababa ang serum potassium, palitan ng potassium sparing diuretic like aldactone. Pag nabawasan ang fluid volume, mababawasan ang blood pressure. Ano pa? Ano pa mga drug therapy natin? So we have different drug therapy in here. We have calcium channel blockers. Calcium channel blockers, it block the influx of calcium ions into the myocardial cells and smooth muscles na ang tunog, amlodipine, nicardipine, nifedipine, also verapamil, diltiazem. ACE inhibitor, angiotensin converting enzyme inhibitor. It inhibits conversion of angiotensin 1 to 2. And example, cipril, captopril, enalapril, lisinopril, ramipril, april, hindi ACE inhibitors, April. Okay. Angiotensin 2 receptor blockers. Losartan, candesartan, telmisartan. Aldosterone receptor antagonist din sila. Beta blockers. It blocks sympathetic stimulation, the heart, and smooth muscles. And therefore, ano nga yung tunog? Olols. Lahat ng olols. Metoprolol, nadolol, timolol, atenolol, propranolol, ayan. So, itry mo na ang isang klase. Kaya kailangan, pagka first time na nagagamot siya, talagang take the drug religiously. Tapos i-check up, no? After a month. Kung okay ba yung gamutan. Kung hindi makontrol yung blood pressure, tumataas pa rin. So magko-combination si doktor. Kaya lang watch out for side effects. Si amlodipine nagkakakos ng leg edema, ng pedal edema. Kaya kailangan talaga monitor the blood pressure. Kailangan marunong yung kasama sa bahay mag-take ng blood pressure as well as monitor for side effects. So the doctor can make combination. Ngayon, kung nagsushoot up pa rin ang blood pressure, the doctor can make an extra dose, which is a PRN. Halimbawa, nagsushoot up, naka-BID na siya, nagsushoot up pa rin to 180, nahihilo pa rin, no? Then, meron siyang PRN, which is placed under the tongue. Okay? Na ano ang complication ni hypertension? Complication can be rupture of the blood vessel, cerebral bleed sa mata, rupture of cerebral vessels, kaya magkakaroon ng blurring of vision. Sa kidney, renal insufficiency, renal failure. Okay? So yun ang iniiwasan, mga complications ni hypertension. In most instances, gaano katagal ang inuman ng gamot? Gaano katagal? In most instances, lifetime. Okay? So kailangan diet, therapy, low salt, low fat diet, advise on small frequent meals rather than 3 heavy meals, exercise, and drug therapy. Okay, ano naman tinatawag natin aneurysm? Aneurysm is abnormally dilated artery wherein it enlarges, no, to at least 2 times its normal diameter. Okay, so nice to know the different types, no? Basta yan, okay, naglolobo, no? Naglolobo at puputok. It could be cerebral artery. It could be thoracic artery or abdominal artery. So, ito ang size, no? Pwede dito sa ascending aorta, okay, then subclavian, and then thoracic aorta or abdominal aortic aneurysm, or pwede rin dito sa may iliac artery. Basta doon sa area na walang muscle support. Pwede, any part of the brain, cerebral aneurysm. Pero aneurysm tends to occur at specific anatomic size, but most commonly, abdominal aorta. Pag nangyari dito sa abdominal aorta, ito yung tinatawag na AAA, abdominal aortic aneurysm. Yun ang AAA. Battery. Abdominal aortic aneurysm. So yun dito, ito yung normal aorta, normal abdominal aorta, tapos andito yung ating abdominal aortic aneurysm. Okay? So, ano ang most telling sign? Lumalaki ang tiyan at may pulsatil abdominal mass. Pulsatil abdominal mass or pulsating abdominal mass. Na description niya, para pong tumitibok ang puso ko sa tiyan. Okay? Di ba? Artery yan. So the pressure exerted by the blood against the vessel wall when the heart contracts is the pulse. So parang may pulso, pulsatil abdominal mass. And patient will complain of abdominal pain, flank pain, back pain. At pag nagpe-pain na siya, it's parang tumatagas na, no? So may tagas ng fluid, plasma, okay? At malapit na siyang pumutok. Malapit na siyang mag-rupture. Ayan, malapit na siyang mag-rupture. Ayan, ruptured aortic aneurysm. Ruptured abdominal aortic aneurysm. It forms when the middle layer or the media is weakened, meaning there's atherosclerosis. Kaya may stretching effect on the adventitia and in the intima of the artery. As the aneurysm grows, putok na tayo. It will rupture. Abdominal aortic aneurysm, pagka daw more than 6 cm, kailangan ng operahan. It could grow as 1.5 times that of size. Napakadelikado na pag more than 6 cm. Chance of ruptured aneurysm. Etiology, atherosclerosis. Pero ibang risk factors, cigarette smoking, ang mga risk factors. Most are asymptomatic. Pero pag cerebral aneurysm, ay yung iba may vomiting, may headache. Alright? Pero yung iba, asymptomatic, silent. So bigla na lang, at age 75, parang nakaramdam ng panghihilo at nagvomit. Ito up and about, 75-year-old female, up and about. Biglang nag-dizziness and vomiting. Consulted the doctor at about 5 p.m. Vomit, nahihilo, awake. So, pinasinom electrolytes. Mababa ang potassium. Kasi inisip nila dahil nag-vomit, kaya mababa yung potassium. And binigyan ng potassium chloride oral. Sent home. So, nakainom na ng first dose ng potassium chloride. And then, another dose siya at kakain ng hapunan. The patient's already unresponsive. Unresponsive na siya. Was brought to the same hospital kung saan nagkonsulta. Kaya lang magsi-CT scan, walang CT scan. So brought to another hospital na may CT scan. At alam niyo po ba, ang nakita sa CT scan, ruptured cerebral aneurysm. And the patient is already unresponsive. The patient's already comatose. So nangyari yon Monday. So binalik sa hospital at naka-respirator. After 7 days, the patient died. Kamamatay lang kanina, 4 a.m. Up and about, walang habilin, walang sinabi, ganun lang, nahihilot, nasusuka. Yung palang suka niya, vomit, is already an indication of increased intracranial pressure. Okay? So, most are asymptomatic until they are discovered by routine exam or during radiographic study performed for another reason. Diba, incidental findings lang. Pero there's steady pain with knowing quality, abdominal, flank, or back pain, especially AAA. Pero with rupturing AAA, bagsak na yung blood pressure. Kasi severe bleeding na tayo eh. Hypovolemic shock, kaya may hypotension na. Cold clammy skin, mental obtundation, oliguria, and dysrhythmia. Ito mabilis. Mabilis ito. Kasi abdominal aortic aneurysm, massive bleeding, hypovolemic shock, altered renal perfusion, altered cerebral perfusion. Okay? So, anong assessment? X-ray revealed eggshell appearance in case of AAA. Pwede rin arteriography o kaya CT scan. It determines the size and location of the aneurysm or abdominal ultrasound. Ito yung AAA. No? Yan ang AAA. At yan yung makikita sa ultrasound. Abdominal aortic aneurysm. Kailangan ng serial ultrasound. Ano yung serial ultrasound? Non-invasive technique that provides accurate diagnosis as well as information about the size and location. Ibig sabihin, the patient will have a series of ultrasound. After 2 weeks, ultrasound delay. After 1 month, after 2 months, para makita yung progression ng paglaki ng aneurysm. Okay. So ano nga initial manifestation, most telling sign? There is a pulsatile abdominal mass. Pulsatile, pulsating. Tapos pag nag-complain na yan ng abdominal pain, ibig sabihin, it is beginning to rupture. And pag confirm na mayroon AAA, palpation, deep palpation, contraindicated because you would cause rupture of the aneurysm. Pagka may aneurysm na-diagnose, AAA, the condition is already life-threatening. Kaya kailangan nang i-manage ang pasyente. Non-surgical management, goal is to monitor the growth of the aneurysm. Ayun, yung frequent scanning, yung serial, yung sinasabing serial ultrasound. SERIAL. Uulit-ulitin para makita ang progression ng paglaki niya. At kailangan makontrol ang blood pressure. Bibigyan sa anti-hypertensive drug kasi ang cause ng rupture ay hypertension. Kaya bibigyan natin anti-hypertensive medication na inaaral natin. At ano yung surgical management? Surgical management is abdominal aortic aneurysm resection, excision of the aneurysm from the abdominal aorta to prevent or repair the rupture. Ayan, ito yung graph being shown, proximal and distal. So, ni-resect abdominal aortic aneurysm o kaya nilagyan ng pinatibay para hindi mag-rupture. So, the goal is to secure a stable aortic integrity and tissue perfusion throughout the body. Kasi once na mag-rupture, puputok, hypovolemic shock. Nasa ng dugo? Nasa abdominal cavity. So the patient will have severe bleeding, peritonitis, sepsis, at hypovolemic shock. Okay? So, nursing care. Prepare the patient for surgery. Anong operasyon? Of course, obtain consent, explain the procedure, deep breathing exercises, pwede. Coughing exercises, bawal umubo. Kaya wag naman nagkaroon ng pneumonia or upper respiratory tract infection si patient. Kasi pag umubo siya, there'll be tension. There'll be tension on the suture line. Bubuka ang sugat. Magbi-bleed. Paano malaman? Bumabagsak ang blood pressure. At there's progressive pain. Paano position? Position the patient semi-Fowler's. Patient never position flat. Pagka finlat mo siya, imagine, kaya ang bilis ang blood flow dyan. So there could be tension on the proximal and distal suture. Avoid activities which increase intra-abdominal pressure. No coughing, no heavy lifting. Okay? No straining of stool. Ayan, yung mga bawal. Of course, we have to monitor the vital signs. Dapat maganda ang ating legs, maganda ang color, maganda ang temperature. The lower extremities are warm to touch, pinkish in color, peripheral pulses normal. Ayun. Okay? So sa pasyente who had abdominal aortic aneurysm resection. Okay, PVD. Peripheral vascular disease is the umbrella term, general term. The blood vessels supplying the periphery. Pag sinabi natin periphery, arms and legs. General term. Kasi it could affect arteries and veins. Okay? Arteries and veins. Pero pag sinabing PAD, arterial lang. Arterial disease. And the obstruction can be partial or total obstruction due to sclerosis. Deposition of fats and lipids along the intima of the blood vessel. Hindi na ito kakaiba sa inyo. Kasi kung tapos na tayo sa coronary artery, ang nagbabarangay ang coronary artery. Ito naman, a blood vessel supplying the arms and legs. Pero ang cause, atherosclerosis. PAD, peripheral artery disease, sa lower S can also be called lead. Ano yung lead? Lower extremity arterial disease. Ayan. So, ayan ating peripheral blood vessels. Ayan, bigger view. There's deposits of fat and lipids along the intima of the blood vessel, atherosclerosis. Ano nangyari? And then narrowed. There's narrowing, inadequate opening. As a result, decreased delivery of oxygen, decreased delivery of nutrients to the lower leg. Okay? Atherosclerosis, deposition of fats and lipids along the intima of the blood vessel. Nagkaroon ng narrowing, hardening, arterial sclerosis. And di ba, normal artery, ang ganda ng blood flow. Eh ito, no, may bara dyan, may bara dito. Ayan ang yellow plaque, plaque formation. The plaque, no, kaya narrowed yung blood vessel. Decreased delivery of nutrients. Kaya ano mangyayari dito? So, there will be change, no, dito na magkakaroon ng pallor, cyanosis, there's pain, there could be ulcer formation, so there could also be thickening of the toenails. Ayan. Dalawang klase pala yun. PAD, ano yung klase? No. Inflow obstruction and outflow obstruction. Pag inflow obstruction, it involves the distal end of aorta and common internal, external iliac artery located above the ligament. So, kung andito yung abdominal aorta, dito sa baba na to, diba? Iliac artery na yan, femoral artery, o tapos popliteal artery, tibial artery. So, from here to dito sa may chingit, sa may inguinal ligament, inflow obstruction. From here, sa singit, femoral artery, popliteal artery, tibial, outflow obstruction. Alin daw ang barado? Femoral, popliteal, tibial artery. Below the superficial femoral artery. So yun yung inflow and outflow obstruction. At ang mga risk factors, most common cause is atherosclerosis. Ano mga risk factors? Hypertension, hyperlipidemia, diabetes, cigarette smoking, obesity, familial predisposition. Assessment. Patient complain of intermittent claudication, pain on the leg muscle after walking or exercise, which forces them to stop. Ibig sabihin, bumaba siya dito sa may tapat ng medicine building. Okay, lahat kayo, nag-F2F na. Tapat ng medicine building, dito sa daan tayo, sa gilid ng KFC. Doon pa lang sa kalahati ng daan, may masakit na siya, may discomfort na on the leg, kaya huminto siya. Pero the pain is relieved by rest. Huminto siya ng about 1 to 3 seconds. O seconds lang ha. After which, lakad ulit, move forward, hanggang sa makarating siya sa gate ng PJP building. So may pain ulit siya. Hinto muna. Parang kumbaga, hinahanda lang niya yung kanyang school ID. Pero sa totoo lang, pinapahinga din niya yung kanyang dalig. At pasok na siya sa PJP building, and then bago umakyat ng punta sa second floor, nag-rest siya 3 seconds. Nakarating siya sa second floor, rest 3 seconds. Kasi sa third floor siya. Nakabot naman siya, pero nagpapahinga. It is reproducible. Relieved by rest. Reproducible. Meaning, mauulit, same characteristic. Ayun, burning, muscle discomfort or pain which forces them to stop yung intermittent claudication. Pag nakita mo nyo po ang term intermittent claudication, that is bad. Ano naman yung presence of rest pain? Kahit wala siyang ginagawa, kahit hindi naglakad, kahit hindi nag-exercise, may pain siya on the leg. Okay? Yun ang rest pain. Siyempre, mas magrabe yun. Inflow disease, Saan nga ang obstruction? Sa lower back, buttocks, or thighs. So yun ang pain. So pagka-outflow, dito sa calves, ankle, feet, and toes. Outflow disease. So, hindi lang pain, hindi lang intermittent claudication. There's also loss of hair on the lower calf, ankle, and foot. No, it is dry, scaly, pale, or mottled. There's thick and toenails. Sorry. Cold extremity and cyanosis. Pallor occurs when the extremity is elevated. The most sensitive and specific indicator of arterial function is the quality of posterior tibial pulse. It is not palpable. Okay. Note for signs of ulcer formation. So, kumbaga, on the left side is arterial ulcer. Ito ay venous ulcer. Ito naman yung diabetic ulcer. On patients with diabetes mellitus. Na meron silang atero and arteriosclerosis. But take a look. No? So, the location and appearance, end of the toe. No? So, ang location of the lesion is ang end of the toe, sa pinakadulo. O kaya in between the toes. It is deep. Ulcer bed is pale. Okay. And it is cold. No? So cold feet, diminished pulses. There could be hair loss, possible gangrene formation. Kung sakaling bulok na yan, kita mo yung ating nails, no? Thickened toenails. Kung sakali na bulok na yan, ikakat lang dito. Cut through the joint. This articulation. Okay, bigger view. Ayun, no? So, pwede ang ulcer doon sa pinakadulo o kaya in between the toes. That's why we have to inspect, no? In between the toes. Thickened toenail. Tapos weak ang peripheral pulse. Whereas, pagka venous ulcer, no, sa saan ang location? It could be in the ankle, no? There's brown pigmentation, okay? So there's ankle discoloration, ayun, no? So saan? Dito sa mas malayo. Tapos ang peripheral pulse, normal. Okay? Dito poor peripheral pulses. Okay? Ito naman, yung diabetic foot. Na konting sugat lang, kagat ng lamok, no? Hindi nagagaling, magnanaknak, parang sang order na lasagna yung paa niya. Foul smelling discharge. Okay, yan, no? So, assessment findings, X-ray. X-ray, visualization of the artery, arteriography. Gumamit ang contrast. So, basta gumamit ang contrast, assess for allergy, kinakailangan may baseline BUN creatinine levels. Okay, invasive, kasi gumamit tayo ng contrast. Non-invasive, segmental systolic BP measurement. Inexpensive, non-invasive method of assessing PAD using Doppler probe. Kaya tawag dito, Doppler scan. At kukunan ng blood pressure. Normally, BP reading in the thigh and calf are higher than those in the upper extremity. Mas mataas ang blood pressure sa paa kasi mas malayo sa puso. But with the presence of arterial disease, the pressures are lower than the brachial pressure. At makukuha yung ankle brachial index. Ano yung ABI? An ABI of 0.9 in either leg is diagnostic of PAD. How? Derived by dividing ankle BP by brachial BP. Okay. Kaya, no? So, yan ang Doppler probe. Okay? Para ma-visualize yung blood flow. Ayan. Doppler probe. Kukunan ng blood pressure, ankle BP, at to that of the brachial BP. Okay? And then, kunin na yung ankle brachial index. Meron tayo sa Fatima. About 5,000 pesos. Okay, Doppler scan. Okay. Also, another test is exercise tolerance testing by the use of treadmill, done by stress test or treadmill, and gives valuable information about claudication. Para bang yung ginagawang treadmill para sa puso. Same machine, na kung kaya ba niyang mag-exercise for several minutes, na or the patient will complain of intermittent claudication. Okay, intervention, exercise. Exercise. Walking exercise is the best. It improves arterial blood flow to the limb through buildup of collateral circulation. Halimbawa, ayan nga itong ating abdominal aorta, then iliac artery, the right and to the left. O, kita mo, may bara na, nagkakaroon na ng bara. Tapos, ito yung collaterals. Yan yung mga sanga-sanga. A good exercise promote growth of collateral circulation. But exercise is individualized. No? People with severe rest pain, kahit hindi naglalakad, nag-exercise, may rest pain, bawal nang mag-exercise. O kaya may ulcer, may gangrene. No? They should not participate in exercise program. Okay. Positioning. Positioning of the client to promote circulation is somewhat controversial. Ano ba yung positioning? Avoid prolonged sitting. Avoid prolonged standing. Kasi pag ang pasyente ay nakatayo, maganda yung blood flow to the leg. Pero avoid prolonged standing. No? Kinakailangan itataas din yung leg to promote venous return. Refrain from raising the leg above the heart because extremity elevation slows arterial blood flow to the feet. Kaya controversial. Ibig sabihin, pag itinaas natin ang paa, it will promote venous return. Pero compromise naman yung arterial flow. In severe cases, clients with pad and swelling may sleep with affected limb hanging from the bed or may sit upright in a chair for comfort. Avoid crossing the legs and refrain from wearing restrictive or constrictive clothing, which interferes with the blood flow. Avoid high-heeled shoes, pero don't walk barefooted. Avoid knee-high stockings. No? Medyo controversial. Pero ang importante, avoid prolonged sitting and standing. There's an exercise given by Mr. Allen para sa may peripheral arterial disease, kaya tawag Berger-Allen exercise. Like, lie supine with legs elevated 2 to 3 minutes. Imagine, mahiga with legs elevated 2 to 3 minutes. Anong pinapaboran? Venous return. Sit up in bed. Mahiga. Okay, sit up in bed and do foot exercises in 3 minutes. Mag-dorsiflex, okay, plantar flexion, eversion to promote arterial flow to the feet. Hold the feet in its position for 30 seconds. Then lie quietly, supine, 5 minutes. Cover with a blanket to promote warmth. Okay, to be effective daw, kailangan 4 to 6 cycles, 4 times a day. Ulit. Supine, legs elevated, 3 minutes. Maupo, and do foot exercises, 3 minutes. Ilan na yun? 6. Tapos, mahiga. No? Mag-blanket, 5 minutes. Yung mga 11 minutes, 1 cycle. To be effective, 4 cycles, at least 4 cycles, no? Minimum 4 to 6 cycles, no? 4 times a day. Berger-Allen exercise, no? Change position gradually. Ayun. Promote vasodilation. Provide warmth to the affected extremity and prevent long periods of exposure to cold. Never apply directly to the limb. Huwag ka naman gumamit dito ng heat pad. Baka ma-burn ang pasyente. Okay? Drink adequate fluids to prevent increased blood viscosity. Emotional stress, caffeine, avoided. Nicotine, avoided. Kasi nicotine cause, 1 stick cause vasoconstriction for 1 hour. Eh kung siya nakaka 26 a day, and then 20 hours, may vasoconstriction. Okay? Ito mo yung effect ng cigarette smoking. May drug therapy din tayo. Hematologic agent. So ito yung peripheral vasodilators. Like Trental, is pentoxifylline. It increases the flexibility of RBC, decreases blood viscosity by inhibit platelet aggregation, and decrease fibrinogen, thus increasing blood flow to the extremities, like Trental, peripheral vasodilators. And bigyan din sila ng antiplatelet agents like aspirin, acetylsalicylic acid. Ang intervention, tulad sa puso, PTCA, sa puso, percutaneous transluminal coronary angioplasty. Dito, percutaneous transluminal femoral angioplasty. So, mag-insert ng special balloon tip catheter, ipoposition sa obstructed vessel, tapos i-inflate, inflate and deflate to compress the plaque. Stents or wire-like device may be used to help keep the vessel open. So the concept is the same as PTCA sa puso, coronary artery. Ito, femoral artery. Or bypass. Ano yung bypass procedures? Grafts preferred are saphenous vein, cephalic or basilic arm vein, or dili kaya synthetic materials as vortex dacron. Ito yung obstructed vessel. Ito yung bypass graft. Pwede cephalic vein, arm basilic vein, o kaya vortex dacron. Kaya that is bypass grafting, femoral artery bypass grafting, or popliteal artery bypass grafting. Ang importante, after the procedure, promote good circulation. Keep the leg straight. Do not flex the leg. Kasi ma-obstruct yung blood flow dito sa back of the knee. Tapos, ano natin, assess the color, temperature, the peripheral pulses. Okay? Meaning, there's good circulation to the lower extremities. That's the concept of the intervention. Okay. Another peripheral vascular disease, Buerger disease. Other name, thromboangiitis obliterans. Angiitis, there's inflammation, the blood vessel. Tapos, may thrombus pa. Anong cause of obstruction? Thrombus and inflammation. Obliterans, obliterated ang blood flow. Obstructed ang blood flow. Exact cause is unknown. Pero it affects the medium and small arteries and vein. Kapag sinabi natin thromboangiitis obliterans, it affects the small and medium-sized arteries and veins, arms and legs. Common among smokers, male smokers. After all, Buerger's disease start with letter B, boy. Common among male or smokers. Kaya, yan ang affected sa fingers at saka sa paa. Cessation, take note. Cessation of cigarette smoking arrests the disease process. But persistence in smoking causes occlusion in the most proximal vessels. Pag sige-sige pa daw naninigarilyo, even the proximal vessels are also affected. Okay? Kaya si patient may amputated leg, below knee amputation, hindi pa rin mapigil sa pagsigarilyo. Kaya, hindi mapigil sa addiction to smoking. Ayan ang kaibigan niya. Kasama niya. Hinihintay lang siya. At isasama na niya. Okay? Kung saan maligaya yung pasyente. So the patient can die of other diseases like COPD, emphysema, lung cancer, bukod pa sa peripheral vascular disease. Okay? Kaya tingnan mo po ang clinical manifestation, claudication of the arch of the foot. So there is pain doon sa pinakadulo, no, na foot. So there's diminished pulse. Tapos may peripheral ischemia leading to ulcer and gangrene formation. Oh, complete abstinence from tobacco is very important. Avoid exposure to cold, no? And treatment similar to PAD. Anong bibigay? Yung ating yung hematologic agent, peripheral vasodilators at saka aspirin. Okay. Raynaud's disease. Ano naman to? It is caused by vasospasm of the arterioles and arteries of the upper and lower X. Arteries and arterioles. Young individuals, more common in women. O, para madaling maalala, women, si ba ang babae sa buhay mo? Sino ba ang reyna ng buhay mo? Babae, reyna. Babae. Exact cause, unknown. But there's vasospasm. Ito yung blood vessel, ha? Cutaway view of the vessel, there's vasospasm. Kaya there's decreased blood flow. So, constriction of blood vessels, decreased blood flow to the fingers, causing them to turn pale. Pallor. Tapos, nag-blue. Tapos, nagkaroon ng vasodilation. It is now red in color. Raynaud's phenomenon. So the color changes. Color, cyanosis, red in color. Kaya phenomenon. Ang tawag sa sakit? Raynaud's disease. Anong manifestation? Raynaud's phenomenon. But sometimes used interchangeably. Pero correct natin, ang sakit, Raynaud's disease. Ang manifestation, Raynaud's phenomenon. Ano yun? Yun yung mga color changes, no? Na nagkaroon ng pallor. Initially, pallor. Tapos cyanotic, blue. At tapos, vasodilation, kaya nag-red in color. Alright? Pwede rin mag-numbness, coldness, pain, ulcer may also be present. Alright. Treatment involves relieving or preventing vasoconstriction by drug therapy. At ang gamot na ginagamit dito ay calcium channel blockers. Okay? Severe symptoms not treated by drug, lumbar sympathectomy. Severe the sympathetic nerve. Okay? Para hindi magkaroon ng vasospasm. Health education, health teaching. Avoid exposure to cold. Avoid stressful environment. Paano natin i-apply? Madaling sabihin yun eh. Yung pasyente maliligo sa bahay, anong tubig? Warm or cold? Warm water. Si patient mag-get out of town, pag-beach, maliligo sa beach pag mainit na yung tubig. Maliligo sa pool pag naarawan na yung tubig. Diba? Nakakatakot yung sobrang lamig, no? Okay, there's vasospasm. At si nanay naman, naiwan sa bahay. Magluluto. Walang kasambahay. Oh, OMG, nakalimutan kong ipalabas yung lulutuin ko. So, hindi na ilabas sa freezer. Anong pwedeng gamitin? Para ilabas niya yung frozen food items. Pwede siya gumamit ng gloves. O pwedeng gumamit ng magsapin sa kamay, towel, para mailabas niya yung frozen food items. Sabi ng estudyante, ma'am, pwede itong. Okay, sige, itong mo yung 1 kilo meat, 1 kilo beef. Hindi mo matutong yan. Diba? Siguro yung tusino na 1/4, ay matutong mo siya. O kaya, gamit lang ng gloves. Tapos, the environment must be calm, warm environment. Not a cold, stressful environment. Yan ang application on health teaching and education. Okay? Next. Venous thromboembolism. Venous thromboembolism. Thrombus. Venous vein. May thrombus, may embolus. Yan ang bara. Thrombus, embolus. Thrombus sa blood clot. Usually as a result of endothelial injury, venous stasis, hypercoagulability. Iyon ang Virchow's triad. Halimbawa, endothelial injury. Yung parating, na-hospitalize kasi siya, naka-IV therapy, 1 buwan, 2 buwan. So there's thrombus formation, di ba? Injury. Extrinsic pathway. Venous stasis. Sino yun? Yung may circulatory stasis, bedridden, paralyzed, comatose, or has an order of complete bed rest without bathroom privilege. So there'll be blood clotting, intrinsic pathway, or hypercoagulability. Masyadong malapit ang dugo kasi meron siyang polycythemia vera. Okay? Venous stasis, paralyzed, no? May order of complete bed rest, o kaya na-operahan siya na orthopedic surgery na matagal bago makakalakad ang pasyente. The patient is at risk to develop deep vein thrombosis. Ano yung embolus? This is a dislodged blood clot or air or fat na natanggal and join the circulation. May deep vein thrombosis siya sa paa na nabakbak and it goes with the circulation. It now called an embolus. Air embolism, secondary to IV therapy, okay, blood transfusion therapy. Fat embolism, kailan yun? Yung mga pasyente na may fracture of the long bones. If you would recall, the long bones, no? Or doon na lang, ulam natin, bulalo. Okay, ang ganda ngayon sa palengke, no? O sa grocery, talagang may silang lagari, no? Electric lagari para i-cut yung mga pata. Di ba? Ano yung nasa loob? Yellow marrow. Okay? So kaya si pasyente, pagka nagkaroon ng fracture of the long bones, the fat cells are released into the bloodstream and goes to the pulmonary artery. That is fat embolism. Okay? O ano naman yung thrombophlebitis? Phlebitis, namamaga ang vein at may thrombus formation. A thrombus associated with inflammation. A client with prolonged IV cannulation is also at risk for thrombophlebitis. Ano yung phlebothrombosis? May thrombus pero walang inflammation. Like when the patient has venous stasis or hypercoagulability. Okay? So in mga terms, you have to understand. So, a blood clot forms in the blood vessel. That is called phlebothrombosis. Walang inflammation. Deep vein thrombophlebitis or deep vein thrombosis, it affects the vein of the leg. It affects the deep vein of the lower extremities. So, there's circulatory stasis at nagkaroon ng blood clot. Okay? So, pag natanggal yan, it now becomes an embolus lodging in the pulmonary artery. Yan nga yung pulmonary embolism. So, etiology, highest incidence of clot formation, of course, in individuals who have, yung kasasabi ko kanina, yung nag-undergo ng orthopedic surgery, na matagal on bed rest, o kaya may invasive procedures such as IV therapy, o kaya may polycythemia vera, or may systemic lupus erythematosus, basta ang pasyente ay may limited activity, malapot ang dugo, risk for thrombus formation. Anong assessment? There is the classic signs and symptoms. There's pain on the groin or calf muscle. It's sudden onset of unilateral swelling of the leg. Unilateral swelling of the leg. Check for Homan sign, although it is not fully advised, because pain in the calf on dorsiflexion of the foot occurs only in 10%. No? Hindi lahat ng pasyente will have the Homan sign. But anyway, okay, so you are seated now. You dorsiflex your foot. Okay, now I am dorsiflexion. Dorsiflex the foot. Tingnan mo kung may pain on the leg muscle kayo. Pagka may pain on the leg muscle, yun yung Homan sign. Deep vein thrombosis. There's localized edema in one extremity. Suggests thrombophlebitis. And gold standard test, X-ray visualization of the vein. X-ray visualization of the vein is called venography. Pwede rin yung duplex scan, duplex ultrasound, Doppler flow studies, no, or plethysmography, or even MRI. Okay? Pero gold standard, contrast, venography, gagamit tayo ng contrast medium, X-ray visualization of the vein. All right. So, ito yung superficial thrombophlebitis, no? Ito deep vein. Ayan, no? So, there's a blood clot. Okay, there's a blood clot. Tapos dito, ayan, no? Anong experience? May tenderness, may redness, may warm, may parabang, may bukol. Okay, there's a blood clot on the superficial vein. Okay? Focus of treatment, prevent complications, such as pulmonary embolism. Ibig sabihin, pagka na-confirm na meron siyang deep vein thrombosis, massage is contraindicated. Ayun, nasan ba yun? Do not massage. Kasi you will dislodge the blood clot and it now become an embolus. Okay? So like, kung naikwento ko sa inyo, yung taga Malolos, no, na tindera, nagluluto, tapos mayroon siyang cardiac tamponade na nakakuha ng 1 liter of fluid sa puso, pero nakasurvive siya doon. Ano ang kinamatay niya? Nagkaroon siya ng deep vein thrombosis at na-baklas. It now becomes an embolus. So kinabukasan on the 11th day, the patient experienced severe chest pain and difficulty of breathing. Nagkaroon ng pulmonary embolism. Yun ang greatest threat, no, to the patient na may DVT. Pagkaroon siya ng pulmonary embolism. Kaya, just elevate the extremity but do not massage. At anong gamot ang bibigay natin? Di ba may blood clot? E di bigyan pa rin ng anticoagulant. Heparin. Okay? Pero anong side effect? Bleeding. Anong antidote? Protamine sulfate. O kaya? Warfarin. No? Ano nga yung warfarin? It inhibits the synthesis of vitamin K-dependent clotting factors. No? Pero 3 to 4 days before it can exert therapeutic effect. Thrombolytics, not to dissolve the blood clot. Ayun. Pero serious complication, intracerebral bleed. Alright? Health teaching. Avoid and stop smoking. Avoid the use of oral contraceptives because it decreases the risk of recurrence. Watch out for signs and symptoms of bleeding. Okay. Last, varicosities. Ano naman yung varicosities? Varicose veins. These are dilated tortuous veins, usually affecting saphenous leg veins because it lacks support from the surrounding muscles. Ayan. Great saphenous vein. Secondary to prolonged sitting, prolonged standing. So it appears as, ayan, parang mga bulate, like snake-like projections, no, at the back of the knee. And ito yung normal vein, mayroon siyang valve. Okay, di ba? Vein carry unoxygenated blood. The blood will flow there, pabalik kay puso, and the valve will close. Pero tama yung varicosities. There's incompetent valve. Kaya the vein fills from above. Dapat si normal vein fills blood from below. Ito, the varicose vein fills from above. Okay? Incompetent valve. Pero pag sinabi nating varicosities, it can also occur in the rectum. Pero ang tawag doon, hemorrhoids. It can also occur in the esophagus. Ang tawag dyan, esophageal varices. Pero since tayo ay cardiovascular, ang pinag-uusapan natin, leg varicosities. Okay. Pathophysiology, it has familial tendency. It runs in the family. In early adulthood, the cause is incompetent valve. Okay? Incompetent valve. Like, eto nga yung normal vein. No? Pagkuklose dapat para hindi babalik yung venous flow. Pero with varicosities, ayun, incompetent valves, kaya it fills from above. Okay. Anything that constrict or interferes with venous return, like prolonged standing, kayo dyan, prolonged sitting, abdominal tumor, obesity, pregnancy, because of the pressure of the gravid uterus, no, on the face, can cause varicosity. It can also happen with thrombophlebitis. Okay. Anong signs and symptoms? Legs feel heavy and tired, particularly after prolonged standing. Sasabihin niya, patient will say that activity or elevation of the leg relieves the discomfort. The leg veins look distended, tortuous, under the skin, as dark, purple, snake-like elevations. Feet, legs appear swollen. Ayan po ang pinag-uusapan natin, moderate to severe varicosities. Legs feel heavy, tired, swollen, namamaga. Altered body image. Nahihiya ako. Makikita nila yung mga alaga ko. Kaya paano niya itatago? Parati siyang nakapantalon. Okay? Sa bahay, parati siyang makapajama. No? Para hindi kikita. One nursing diagnosis other than altered discomfort is altered body image. Ang diagnostic test. Brody-Trendelenburg test. Lie flat. Pahiga. Elevate the leg. It will promote venous return. Kaya yung mga veins empty. Then, apply tourniquet on the legs, the upper thigh. Ipatayuin mo siya. Ask the client to stand. If blood flows from the upper part of the leg into the superficial veins, then the cause is incompetent valve. Again, lie flat, elevate the leg. It will promote venous return. So, empty ang mga veins. Talian ang hita. Patayuin. Pag nag-distend yun, no? Meaning, the veins, no, is filled from above. The cause is incompetent valves. Pwede rin ultrasound at saka venography. Okay? So, anong medical management? Mild varicosities, exercise, like walking, swimming, lose weight with puppies, wear elastic support stockings. Katulad na, the nature of our work as nurses, kailangan nyo mag-wear kayo ng elastic support stockings. Di bali ng mahal, magkano ba yun? No? Mga 200 pesos. No? Pero talagang, bukod sa matibay, no? Talagang support stockings. No? Kasi, kailangan natin, yung the nature of our work, especially kung ikaw ay OR nurse, no? Kasi parati ka nakatayo, you assist in the craniotomy. Ay, ang tagal talaga ng operation. We had one patient na nag-Whipple's operation na actually, inumpisan nyo ng mga duty ng, ng 2 to 10. Umuwi na sila ng 10 o'clock. Alam mo, pag kinabukasan, nandun pa rin yung pasyente. Inooperahan pa nila. Whipple's operation. Magbabaricosities ka talaga. Kaya kailangan mo ng support stockings. Okay? Then, the medical management. Gamot. Daflon is one drug. Anti-hemorrhoids. It will reduce swelling and inflammation of the veins. Okay? Tapos, health teachings, avoid prolonged sitting and standing. Siyempre, hindi naman avoid pregnancy. No? So, kinakailangan talagang manganak, magbuntis. No? So, just elevate the legs in between. Alright? Ngayon, kung gusto magpa-opera, naisorbo ka, the vein ligation. Veins are tied up, tinalian. But the dysfunctional vein remains. Pero kung sinabing vein stripping, ligated veins are severed and removed. Ayan. So, dapat vein ligation and stripping. Kaya, ayan. Ito yung before, andyan kanyang mga alaga. Ngayon, after the procedure, malinis na. Pwede na siyang mag-two-piece. Okay, pwede na niya ipakita ang kanyang mga legs. Alright. Nursing management. Assess the skin, distal circulation, peripheral edema. Post-operative nurse monitor for swelling the operative legs and its effect on circulation. Nurse can remove and rewrap the roller bandage kasi may roller bandage. No, facilitate blood flow. Nurse inspect the dressings for signs of active bleeding. Immediate post-op period. Ito, elevate the foot of the bed. Elevate the foot of the bed to promote venous circulation. And remind the client to alternately contract and relax the lower leg muscle para maganda yung blood flow. And board question, what is important is encourage ambulation on the day of surgery. Para maganda yung arterial flow, maganda yung venous flow. Okay? I guess this is the end of my discussion on the diseases of the blood and the blood vessels. Okay? So questions? Any questions on the topic? Most telling sign na meron siyang AAA. Anong most telling sign? There's pulsatile abdominal mass. Okay? Since tayo po ay asynchronous tayo bukas, quiz ibibigay na natin bukas para you have also time to review. All right? Next week will already be exam week. Exam for 312 as scheduled, as planned, will be on Thursday and Friday. Okay? So face-to-face para sa professional subjects. Okay? Gen Ed minor subjects will be given online. Okay po? Questions, clarifications? So this is section 7, 8, and 9. Okay? Questions, clarifications? May question po ba? Nandiyan pa po ba kayo? Tingnan ko lang kung may announcement tayo dito. Okay, may chat. May duty po ba next week, Thursday and Friday? Since yung iba wala pa naman talaga duty next week, di ba? Lalo na yung naka-skills lab. Sino yung naka-skills lab?